Hello, everyone. Welcome all. I'm Dr. Fatma Asom, Medical Coordinator in the American Association for Continuous Education. First of all, on behalf of our association, I would like to welcome you all in our webinar titled New Collagensis Era, the Evolution of Biostimulator and Skin Boosters. Today, we are honored to host a distinguished group of professors and doctors who will share the newest updates, advanced techniques, and latest scientific insights in the field of biostimulators and skin boosters. I would like to begin to introduce our professors and doctors who are going to share with us today. First of all, Professor Dr. Mustafa Isa, Professor Dr. Kyung Tae Bae, Dr. Noura Dibar, Dr. Maher Solah, Dr. Fos Rostress, Dr. Muhammad Abuhaleima, Dr. Dania Isa, and Dr. Maria. Okay. Lastly, for all our attendees, please make sure to stay with us during our webinar, and please make sure to stay until the end. After each speaker's session, we are going to have a Q&A segment, giving you the opportunity to ask our experts any question related to the presentation and related to our topic. And also during the webinar, you are going to find attached in the chat box, you are going to find a certificate link. Make sure you need to fill this link in order to receive your attendance certificate. And also you are going to find a registered link for those who are interested to join our courses and to choose which course you want to join with us in our upcoming courses. Before we begin our sessions, I would like to share with you a short video introducing the American Association for Continuous Education. You are going to learn more about our story, our courses, what we offer, our educational activities, and for sure our accreditations. And now with the video.
Hello everyone, hope you're doing great. I'm Dr. Maher, business developer here in the American Association. Today, I'll give you a brief introduction about who is the American Association. We will know more about collaboration, accreditation, and our services. American Association is an international educational organization that specializes in continuous medical education. We are focusing more on hands-on, more than theoretical part. We have different offices. We have our scientific office in Delaware, USA, UAE in Dubai, Egypt. We have 2 branches. Also, we have our new office in KSA in Riyadh, and soon we will open our new office in Iraq. Here in American Association, we offer different services. We made more than 1,000 semi-hours program, in addition to 32,000 semi-hours. Also, we offer customized program according to your needs. Regarding the conferences, we made more than 7 conferences in different specialties. We trained more than 16,000 physicians from all over the world from more 22 nationalities. What about the webinars? We offer more than 25 webinars for free for all physicians all over the world. And here in American Association, we call the hubs. Let's see a video about American Association together. American association who offer new services called fellowships with collaboration with the most prestigious universities. Let's move to the most interesting part, the accreditation. We took full accreditation from Accreditation Council for Continuing Medical Education that's located in Chicago. Why it's important? Because the Accreditation Council, one of the biggest accreditors in the world, that gave accreditation to Harvard Medical School, Johns Hopkins Medical School, Stanford Medical School, Saudi Commission, and Dubai Health Authority. Not only that, but also we consider an American association the first organization that took this accreditation in Egypt and one of the most important organizations that took this accreditation in the Middle East. Not only that, but also American association took a lot of accreditations from different accreditation bodies, like American Association of Continuing Medical Education that's located in San Francisco. We consider the regional partner here in the Middle East for American Association of Continuing Medical Education. Not only that, but also we have an office in Dubai, so we took accreditation from DHA. We have an office in Saudi, so we took accreditation from Saudi Commission. We have an office here in Egypt, so we took accreditation from National Quality Institute that we are certifying training center. At the end, we took 2 ISOs, ISO 9001 in Quality Management System, and one of the most important ISOs, ISO 21001 in Training and Education. Why it's most important? As we are 1 out of 5 organizations in the Middle East that took this ISO. So what about collaborations? We made several collaborations, as there is no organization who will collaborate with another organization without trusting in their curriculum. We met with WHO, World Health Organization, Egyptian Ministry of Health, United Nations Population Fund in different initiatives. Not only that, but also in aesthetic gynecology field, we made a lot of collaborations, like World Society of Cosmetic Gynecology, Brazilian Academy of Cosmetic Gynecology, Indian College of Cosmetic Gynecology. Also with different ministries, like Iraq, Jordan. Not only that, but also we made with Thinking Academy, Bahia Foundation, International Menopausal Society. At the end, our collaboration will not stop here, as we will make a lot of collaboration in the future. We offer different diplomas in obstetric and gynecology, like Basic Aesthetic Gynecology, Advanced Aesthetic Gynecology, ART for Obstetric Gynecology, IVF and eggs for Obstetric Gynecology, Fetal Medicine Obstetric Gynecology Basic Ultrasound, Fetal Medicine Obstetric Gynecology Advanced Ultrasound, Maternal Obs and Gynae Ultrasound Basic, Maternal Obs and Gynae Ultrasound Advanced. So what about dermatology? Aesthetic medicine, laser and aesthetic devices, hair aesthetics, dermatology and trichology, non-surgical body contouring, advanced nose and neck, advanced botulinum toxin, advanced filler, advanced threads, advanced lips, regenerative aesthetic injectables, biostimulators. Let's move to surgery part. Hysteroscope, laparoscope, colposcope, hair transplantation, fat and nanofat augmentation, liposuction and body contouring. And all our scientific programs are checking and reviewing from scientific committees located in the USA. So all of these points increase from our credibility. The last service we offer here in American Association, HUPs. What the mean of HUPs? HUPs are online free webinars that include global experts from all over the world, Q&A session, educational video demonstration, also certificates, semi-E, attendance certificates. Not only that, but also ask the expert any questions that you want. The last but not least, the conferences. American Association offers different courses in different specialties. We offer more than 7 conferences. In the conference, you can get your certificate, you will know the latest update and the guideline in the field that you want. Not only that, but also you get certificates, semi-hour certificates, attendance certificates. At the end, I don't want to speak more about the conference, so let's see that together. Zain, I'd like to thank you for being a part of American Association.
Thank you all for watching. And now we are going to start our sessions with our respected professors. On behalf of our association, I would like to thank you, all the speakers, for detecting their valuable time to be with us. And for sure, thank you for all the attendees. And I hope for you all to have a very great time. Lastly, before we start, I will make sure again that you have to write any question you need to ask our professors. Make sure to write it in the chat box so they can answer you. And now we are going to start. We are honored to welcome Dr. Kyung Tae Bae from Korea. Dr. Kyung is the chef director of its Me Clinic in Korea, board member of the Korean Aesthetic Surgery and Laser Society, board member of the Korean Academy of Facelift and Contouring, key opinion leader of Wero, and key opinion leader of Dior. Dr. Kyung will be talking about a practical guide to safe reconstruction and injection of PLLA. We are excited to hear from him, and now with Dr. Kyung. Hi, Doctor. Hello.
Hello, everyone. Nice to meet you.
Hi, Doctor. Hello. It's our honor to have you today with us in our webinar.
Me too. It's a pleasure to be here again, and it's always being an honor to speak about in front of you, and also being a part with the American Association. So, shall we begin?
Yeah, we can begin.
Okay, so
if you want, you can share your presentation. We are ready.
Good.
Okay, we can see your presentation, Doctor.
Our favorite material to use in our practice. So what I'm going to talk about is a practical guide to safe reconstitution and injection method of PLLA. So shall we begin? I'm a chief physician of It's Me Clinic in Sejong City, and I am working with Korean Society, two Korean Society. And also I speak for many companies, and also I travel a lot for these scientific and also sponsored lectures. So let's begin. So in our body, when we inject biostimulators, such as like these biostimulating polymers, we target the dermal layer, or inside the dermal layer, we call it subcutaneous layer, to enhance these exact components of like enhancing the collagen stimulation. So when we inject biostimulating polymers, the body undergoes into the foreign body reactions, and also it can make new collagen. So we call it bioremodeling from the inside to the outside. So in the clinical positioning of fillers, we can categorize by these two. One is a volumizer, and the other one is a biostimulator. So as we know, HA fillers are mainly for the volumizing. And also they are small particle size HA or non-cross-linked HA, which we call it as a skin boosting HA fillers that is meant to hydrate our skin. And also there is a PCL. It's a powerful collagen stimulator, and usually we use it as a volumizer or a lifting method instead of using thread. And these days we have liquefied PCL, so the indication has been expanded. Also, we have CAHA and PLLA, and finally we have PLLA. By the reconstitution ratio, we can distinguish as the volumizing effect or skin firming, tightening, or even the skin tone and surface evenness. So what is PLLA? PLLA is a combining lactic acid. There are four types of polymers of PLA. So they are isomer. So this is a L type, and there are also the D type. We don't use D type because it is not that we don't have that evidence, and there is a clinical paper that we compared with PLLA and PDLA into the rat, and PDLA showed like unstable collagen stimulation. We cannot predict it, so that's why we use PLLA. And also there's a combining mixture of PLLA and PDLA, so we call it PDLLA. But mainly today I want to talk about the PLLA. PLLA usually we call it well, for this one is a sculptura, and this is a famous components that we usually use in our clinic worldwide. So when these little particles goes inside to our body, then it can make a foreign body reaction, and the neutrophil gathers like this. And also they cannot eat these little particles, so that they gathers a little bit more macrophages, and then they cannot eat it also, so they make a fusion, so that it is called giant cells. And then the cytokines such as like PDGF, TGF beta, these kind of growth factors and cytokines excreted from these giant cells, so that it could gather the fibroblasts. And then the fibroblasts finally make like these kind of new collagen inside our body. So that's why the dermal layer can be strengthened, or the volumizing effect can be occurred by these injections. So for example, they had the different materials or products have different types, and also the different amount of the main components called PLLA. There is a sodium carboxymethyl cellulose, which we call CMC, and mannitol. It could stabilize these kind of microparticles inside of our body. So we sometimes some people like concern about the microplastics, but these kind of PLLA or PDLLA, like these polymers, like PCL, also the PDO, these kind of polymers, we don't have to worry too much, because microplastic, they are made from polyethylene, such as like we make it vinyl or plastics, right? But these are 100% biodegradable and absorbed, and they turn into CO2 and H2O, glucose and lactate after the degradation. So this is the different material. It is it has a history, and they can degrade 100%. So you don't have to worry too much. So as I mentioned earlier, if we inject it, then the macrophage gathers, and then they turns into the giant cell, and they gather fibroblasts, and then they make new collagen. And recently, the paper said that they can make lipocyte, so that they can like actually make a volume. So these are the new things that you have to understand, and you have to know about it. And after about 5 days, and the collagen make after about 5 days, and they last about 1 to 2 years. So as you can see, as I mentioned earlier, the PLLA components can gradually degrade inside our body. As you can see, after about 12 months, you can see in the histological image, there's a crystal form of PLLA, and after about 30 months, there's none. Instead of it, there is a orange color collagen inside of our skin. So the scientific evidence about PLLA. We all know foreign body reaction well these days. If the components go inside, the macrophage change into M1 or M2 by the polarization. So M1 polarization, it can make inflammation. And M2 polarization, it can make regeneration effect. So some particles goes into like the macrophage goes into M1 phase, and then they turn into like M2 phase. So balancing these two, the polarization is very essential, and also the components of like PLLA or PDLLA can actually make, if the companies made these components well, then it cannot make like goes into like the M1 phase instead of M2 phase. So we are focusing to make more M2 phase macrophage polarization. That is key points. And also, as you can see, they can make M2 polarization. If they goes into M2 polarization, then it can make more collagen so that it could, we think it as a good polymer. So these are the main key cascade of the PLLA injection. They actually increase the cytokines such as like interleukin-4, interleukin-3, 13, so that it can make more M2 polarization of the macrophage, and it can synthesize new collagen, and they can suppress the collagen degradation. So that's why if we inject PLLA into our skin, then we can make skin rejuvenation. And these are the human tissue injection, the results of by the paper from Galdama. And there is type 1 collagen. If you can see type 1 collagen and type 3 collagen, you can see compared to the baseline, the all two types of like type 1 collagen and also type 3 collagen has been increased by the injections. So these are the magnificent results, and magnified histological image. You can see clear the crystallized PLLA crystal, and also you can see the orange color and red color as a collagen. So the far left is the baseline, and the middle photo is 3 months after and 6 months after. You can see a well-organized collagen type 1 and type 3. And these can also change the microenvironment of our cells, and it can make mechanical force changes outside of the cells. So if the mechanical force goes into our between the cells, and then it can make a piezo-1 calcium channel to be opened. So the calcium from the outside, they go inside to our cell membrane so that it can change the electric signal inside of the cell. So that's why the piezo-1 calcium channel opens and calcium goes inside, and they can make a cascade of the synthesis of new collagen that is called mechanotransductions. So if we like slash your like chin, or like you make a pinch, then you can also make a mechanical force. But constant and gradual mechanical force can be made more efficient collagen inside our cells. So PLLA can do it. And also there is a regenerative actions of PLLA. So this is the paper from Korea, and they grew adipocyte in vitro, and then they put PLLA outside of the cells. So if we put like if we check the cell viability test, UVB obviously cytotoxic, PLLA is not cytotoxic, so it means it's safe. And also they saw adipogenesis adipogenesis results by using this PLLA, by just pouring it. So they measured how do they make it. So they measured PLLA could promote expression of type 4 and type 6. We only cared about type 1 and type 3. But this paper saying that type 4 and 6 collagen also generated within the adipocytes. And also, they can make a partial restores of collagen gene expressions. What it means is that type 4 collagen can make differentiation of adipocytes, and type 6 collagen can maturate the adipocyte. So it can be actually not only making the type 1 and type 3 collagen and to make like the regeneration effect on the skin, also it can make new adipocytes. So it can make actual volume of it. And this is the latest research from Galdoma and PLLA. They measured only the adipocyte and dermal thickness, and you can see lipid contents increased after using PLLA injections. And also, you can see the adiponectin and leptin to be increased after the PLLA injections. This is from the, like in March, we had an AMWC Monaco, and the global team announced these papers. So, and also they checked the gene expression by after using PLLA. You can see like these kind of genes is increased. So PLLA could actually make fibroblasts increase, and they can lead to dermal thickness, and also they can make new regenerative effect on adipocytes. So suitable indications for PLLA injections are mainly for the dermal remodeling to restore like pores, reduce the pores for scars, wrinkles, stretch marks. But also we can use it as a volumizer and lifting. And these are based on skin firming. So we saw already about the foreign body reaction, but if it's too much, then it could make one of the most concern of using polymer. And you can make, if you use it, then you can make too much foreign body reaction. So we can make nodules, and also we could make granuloma by using too much polymer in a specific area. So we don't want this, right? So possible causes of nodule formation is too concentrated, or if you inject too much injection in the same area, you can make the nodules. Or between the sessions, we recommend in 4 weeks, but if we use it, the session is too short, like 1 week, 2 weeks, it can aggregate the PLLA particles, right? So that we have to secure the sessions between the sessions. And also, if you use it into like foreheads or under eye area or neck, which is we known as a thin skin, then we could also make nodules. So most companies don't recommend to use like these areas, but they still, we need to like also we have skin and like subcutaneous layer. So we need to enhance these areas also. So how can we use it safe? By using appropriate reconstitution method, and also by using the right method of clinical use of PLLA can prevent like these kind of side effects. So what I prefer and I recommend to use, this is my protocol. The Sculptra is one of the example. You can also use other kinds of polymer in the same way. So I use it, the reconstitution with sterile water, 6 ml. And then I mix with cold HA, non-cross-linked cold HA that I prefer, and to reduce pain, injection pain, because sterile water is not the exact set of the osmolarity. So I intentionally mix tumescent solution, pre-made tumescent solution, to reduce the pain and set the exact pH. And then we use this mixing method with the back and forth mixing with the 3-way, or otherwise you can use 2 ways. So I make total 10 mils of polymers. And as you can see, the milky and constant, also the shape and concentration is well formed. So these are my method, and I would recommend it. And also I would like to share the tumescent solution. I make it every day and use it for anesthesia and mixing, reconstitution, or even I use it for the skin botulinum toxin, and then I just dump it after the day is off. And I make a new tumescent solution every day, every morning. This is cheap. So I want to share how I mix it. So these are the vial of PLLA, and I'm pouring the 6 mils of stirred water, and gently you just roll it like this. And then after about at least 30 minutes, we can additionally mix non-cross-linked HA and tumescent solution. So as you can see, there is a clear, the well diffused particles inside the bottle. And then I draw all the liquid inside of the bottle. And then I connect it with the 3-way. And these are the non-cross-linked HA, 2 cc, cold HA. And by using back and forth method, you can see how it's well mixed inside the syringe. Okay? So, PLLA reconstitution preparation, which is good when it is well mixed, then it has a color of milky milk. And then if it's bad, if you didn't do it well, then you can see like the irregular translucent color and the presence of the powder. So it's not safe. So you have to use, or you have to mix it more, like at least 20 to 30 back and forth methods. Okay. So why I use stirred water instead of normal saline? There is a comparison between using various solvents when you mix or reconstitute with like kind of these polymers. So they used sterile water, normal saline, lidocaine, and epinephrine with lidocaine, and also mannitol. Looks regular, well mixed in our bare eyes. But let's see in the magnified. So it also looks like kind of well diffused by all solvents. But look at close. In the red circle, you can see the aggregation of the polymer particles. If you inject like these kind of material, we cannot see in our bare eyes, but these are possible cause of nodules. So B, if you see the B photo, then there is no aggregation, but others have a little bit of aggregation. So that's why I use sterile water instead of normal saline. And the second thing, why we mix with cold HA. PLLA with HA also, obviously, they have synergistic effect. But the main thing the reason why I use HA with polymers is that it can make viscosity. If the viscosity increase, then the particles could be well dispersed and held in one place, not reducing aggregation. And also, if the temperature goes down, then the viscosity also increase. So the reason why I use cold HA is to make a viscosity. And also when you inject it into our skin, subcutaneous layers are not as dense as dermal layer. So if you target the subdermal layer by using cannula, then the HA could hold the particle near the dermal layer so that it could maximize to make more collagen. So that's why I use PLLA with HA. Where you target is subcutaneous layer. There's many fibroblasts and many pre-adipocytes in subcutaneous layer, especially near the dermal layer. We call it subdermal layer. So we want to induce more collagen near the dermal layer and also the retinacular cutis layer, so that it could make a strength and also the stretching effect by using this area. And the techniques of injecting PLLA, you always think of even distribution, smooth injection, and constant layer injection by using cannula. I usually use 23 gauge cannula, and long and multiple strokes with cannula is needed. So make many lines, and you make a plane. That's my concept of the techniques. So we can make various puncture sites, especially to cover nasolabial folds and also the lateral cheek. And also we can make extra puncture site near the tragus we can cover the temple and also the lateral cheek. And also we could cover the marionette line by using the below puncture point near the mandible. And also we can also target the anterior cheek by using these kind of puncture points. So let me share the video. So I draw and design it. Okay, and I make a local anesthesia with sites of the exact sites of the specific area to cover these pre-drawn areas. And I use 23 gauge 50 millimeter cannula, and I secure the depth and the layer. If you're in the right depth by using this cannula, then you will see the clear shape of the cannula. But if you're too deep, then if you raise your cannula, then you'll see a blunt elevation of the skin. So if you want to secure the layer, then we have to elevate your cannula and see how the shape of the cannula is. And if you're in the right layer, then you'll feel almost no resistance when you go back and forth. But if you're targeting another layer, especially dermal layer, then, or like penetrating the muscle, then the patient will feel pain and you'll feel resistance. If the patient feel resistance or the pain, you're like touching the wrong area or wrong depth of it. Okay. Also retrograde injection, and I focus into it. My dominant hand is right hand, so I focus to constant pressure of the right thumb, injection thumb, and I use many lines. And then after the injection, as you can see, I squeeze the puncture point. Why? The cannula injection could make a retrograde backdrift. So in the puncture site, the particles could aggregate. So that's why I use a pinch after the injections and then remove the droplet. Okay, so you can cover like these areas, and also the marionette line. And also we can cover the forehead, which is the company do not recommend it, but as far I've been using this so many times and so a lot of vials, but I had never experienced about the nodule by using these methods. So you can cover under eye area, forehead, or all over the face, and also you can use it for the body. Okay. So this is a procedure video, and PLLA injection protocol that I recommend is 3 sessions in intervals of 4 weeks, and repeat the treatment session every 6 to 12 months. Okay, so this is my final take-home message. Appropriate PLLA immersion can produce effective and natural, safe results. And my recommended reconstitution ratio is 6 ml of sterile water with cold non-cross-linked HA 2 ml and 2 ml of tumescent solution, total 10 ml per vial. And the injection method and technique is very important. So even injections into the dermal plane, subdermal plane, and use long strokes and multiple strokes to make a plane, not just a line. Okay. So the PLLA, if you do it right, if you do the right reconstitution method, then it can make balanced and natural skin tightening and facial volumizing. Okay, so this is my end of my presentation. So with that, thank you for your attention. So if you have any questions, please ask me, or you can contact me into my Instagram. Thank you.
Thank you so much, Doctor. It was really a great session. Thank you so much.
My pleasure.
And now if anyone has any question, you can write it in the chat box. Okay, for the first question, how can I can resolve nodular or granuloma?
Okay, thank you for the question. And if you have nodule problem, you can use we have some methods. So first thing that you can do is to inject triamcinolone, which is a steroid, to resolve it. And second thing, we can use CO2 pinhole method to break down the nodule. Usually nodules are made of not this like the aggregation of collagen, but it is made in about 1 or 2 weeks, and it is made of the aggregation of polymers. So you can, if you can break down by using it, then we can make the resolve of the nodules. And also we can use monopolar RF by using heat, or even microneedle RF. So you can use steroids injection, CO2 pinhole method, and also the RF, heat accumulation. But granuloma is different. Granuloma actually it appears after about like 12 months or like even more. And this is a kind of immune response. So in that case, you have to like keep doing injections of like steroids, hyaluronic acid to resolve the aggregation and to reduce the inflammatory responses. And actually, either we have to wait or you have to do the surgery, because there's so many like kind of bundles of collagen, and also there's so many like irregular responses inside of our body. So nodular and granuloma is kind of treatment method is kind of different. Nodules can be treated easily, but granuloma, yeah, you have to think about it.
Thank you, doctor. Another question: what about using this PLLA for body, and where all it's indicated?
PLLA can be used into mainly in like Latin America. They use a lot into our butt, like hip. And also I have some results of the breast. So I mainly focus with the upper breast to like lift up the like the sagged breast, but it actually made upper breast to be volumized and tightened. So I recommend to use upper breast and also into the butt, hip, and also these days in Korea we use it for like the elbow wrinkle, and also above the knee. If you lose the laxity, then we can use it to upper knee also. And hands, dorsum of the hands is also fine. Yeah, we can use various ways.
Thank you, doctor. For the last question, what about using this PLLA mixed with PDRN? Can we use it mixed?
PDRN, yeah, you can mix it with PDRN, also PN. Because think it as PN as a nutrient for the body, and PLLA is actual working. So think it as if you do exercise, we eat protein, right? So think it as PLLA is an actual exercise, muscle strengthening exercise, and PN as a protein. So we can make better. And there is a product that it is already mixed with PLLA and PN. So it's quite effective. Yeah.
Thank you so much, doctor. Thank you. It was a really great session. Thank you for your time and for your effort. Thank you. And we are really happy to hear from you. Thank you so much.
Thank you.
Thank you. And now we are pleased to welcome Dr. Muhammad Abuhaleima from Egypt in our webinar. Dr. Abuhaleima is specialist in oral and maxillofacial surgery with extensive experience in cosmetic and facial aesthetic procedures, facial aesthetic fellowship from Italy. It's our pleasure to have him today with us, and he's going to talk about why biostimulators are considered the secret weapon for timeless beauty and long-lasting results. Dr. Muhammad.
I prepare my presentation. Hello, first everyone. It's a pleasure to have you here. Thanks, Dr. Keen, for your interesting talk. I'm Dr. Muhammad Abuhaleima, cosmetic and facial aesthetic surgeon from Egypt. Okay. It doesn't work.
No, still we cannot see your presentation.
Okay.
Okay, it's already being shared. Now it's shared.
Okay. Okay. Everything is okay?
Yeah.
Okay. Hello, everyone. Our talk today will be on biostimulators its role in aesthetic medicine, types, and mode of action. And the end of our webinar, we will discuss together a case injection. Basically, we can see nowadays the demand of volumizing has declined the last year. From my point of view, the increased demand of biostimulators like biostimulation and bioregeneration rather than volumizing, we are trying to restore youthful volume and trying to treat symptoms. We see here the mixing of biostimulation and bioregeneration for facelift and smile lines correction, and also skin tone improvement and skin quality enhancement. And we'll discuss more and more on upcoming slides. First of all, collagen stimulating treatments are trendy. Nowadays, we hear about calcium hydroxyapatite, we hear about PLLA only, and also PLLA with hyaluronic acid. And my exclusive approach, NucleoReach, it's a combination of PLLA, Reach PL, and NucleoScan for skin regeneration, like salmon DNA, glutathione, and hyaluronic acid 10 milligram cross-linked. We chase collagen, we don't chase volume. Biostimulators aren't replacing filler. In some cases, we replace fat layer by filler injection in certain points, especially after weight loss in short time for restore the volume, but
Dr. Muhammad, can you hear us?
in an inflammatory
Just 1 minute and the doctor is going to join again. We're sorry, Dr. Muhammad is going to join. Just there was a little bit problem with the connection. So just 1 minute and he's going to join again. Dr. Muhammad, welcome back.
I'm so sorry for interruption.
Okay, no worries. It's okay.
Everything is perfect?
Yes.
Okay. Biostimulator, we are going inflammatory process by recruiting macrophage and fibroblast activation for collagen type 1 and type 3 stimulation and also elastin, but it takes time for improvement. We can see here this case for neck tightening. You are used in this case biostimulator for face and also for neck. I always say the neck improvement comes from face. I don't recommend neck treatment only. And main types of biostimulator in all over the world, calcium hydroxyapatite, like Radias. It acts as the scaffold for face. We can use it in face, also neck, and we will see on upcoming video. We are using it on hands. It's powder. It's 1.5 calcium hydroxyapatite syringe we diluted with 2.5 cc saline for full diluted syringe 4 cc. And we use this mixing method as we saw on the previous presentation for final result of milky appearance of diluted radius. We are using hands injection by cannula for hands rejuvenation and restore youthful volume, and also hidden of veins and tendons for hands. This result after 40 days of injection. And also another biostimulator of polylactic acid, Sculptra. It's a powder stera vial. We diluted with 10 cc saline. It's not hyaluronic acid. It's a biostimulator that required specific preparations. Were injected in dermis. It acts as the scaffold to stimulate collagen and results for calcium, and Sculptra lasts for 2 years minimum. And also polylactic acid with hyaluronic acid. Like Rich PL, we can see immediate volumizing after injection and also skin quality improvement. But unlike Sculptra, it's already reduces it's already diluted via ready to use. And we can see the result of my patient 70 years old. We can see skin quality improvement and saggy skin correction for smile lines. And also we use polydeoxyribonucleotides like BDRN under eyes for whitening. We are working on laxity of skin and skin tightening, and also lifting and depigmentation for full face, and also for under eyes, and also doing some lip filler injection for lower lip for lips harmony. And also working on neck tightening for the same patient, as I said before. Skin tightening comes from the face, from the jawline area and the chin. We can see skin tightening and sagging skin treatment for our patient. It's 70 years old. We combine here NucleoReach, the Reach PL injection polylactic acid, and also NucleoSkin, hyaluronic acid 10 mg, salmon DNA, and glutathione for depigmentation. This is another case for NucleoReach injection. As we will see, as the patient explained, the instant result of our injection of right injected side for under eyes, correction of puffy eyes, and the cheeks lifting and the smile lines correction, and also the marionette line treatment versus left one. And here, result after 1 month, we see a complete correction of under eyes area, puffy eyes correction, and cheeks lifting, and smile lines also, and marionette lines correction. I always say there is no ideal patient for any injection, but I don't recommend biostimulators injection for young age. I prefer biostimulation injection for mid-age and old age also. Awareness of your patient nowadays is crucial. It's all about filling your mind instead of filling your face. And as well, we said before, it takes time for skin quality and skin tone improvement. And I prefer using hybrid techniques like my exclusive NucleReach approach, Reach PL with NucleScan, and also using filler injection with biostimulators, especially after weight loss, massive weight loss in a short time for restore youthful volume. We have to consider proper dilution of our product and precise injection, and also avoiding overdone, and asking your patient for the good results after 1 month. And it takes time, gradually improvement over 3 months for the full result. The common issues for polylactic acid, like improper dilution, we have nodules and granuloma. And if you have a low awareness of your patient and delayed expectations, we can see here our case. Our patient is complaining of skin laxity in mid and lower face. She wants to go like this effect. If we are going to clinical assessment of mid face for more details, we divide our face from this line for lateral and medial part. The elasticity isn't great anymore. We are trying to reestablish the connection between dermis and subcutaneous in lateral part of face, and work on also on the laxity of mid face. First step, we use dry gauze for injection in a clear field. And first, we for injection, we insert our needle for open the door for our cannula from high point of cheeks, and also we'll see we inject from another point of view at the angle of mandible, and we feel some resistance, we will go back and reinsert our cannula. We see here acne scars, so we feel some resistance in injection. We push our material in retrograde injection. we can also massage during injection and ask our patient for home massage for more efficient results. And I avoid injecting my product in infraorbital region for immune response reaction, and also avoid to inject PLLA in nasolabial fold for avoiding accumulation of the product in smile lines. And I always say the layer of injection can be kind of designed to what to do and what to achieve. When we want to enhance skin quality, we can go for derms, and if we are looking for more stability of the product, we can go little bit deeper. We can see here the result after only 3 weeks. We are seeing here the magical result for skin tightening and skin lifting also. And there is an skin quality improvement and enhancement for white pores and acne scars as well as. Thank you.
Thank you so much, Doctor. It was a really great session. Thank you so much. And now, if anyone have any questions,
So sorry for the interruption.
It's okay, no worries. Thank you so much. Thank you for your time and for your effort. If anyone has any question, please write it in the chat box. Okay, we have a question, Dr. Muhammad. Best way to avoid granuloma and nodules?
Choose your patient and your precise technique, and also proper dilution for your product using mixing technique we saw in my videos.
Thank you so much, Dr. Muhammad. Thank you. It was a really great session. Okay. Thank you. Thank you. Thank you.
There is a question. Safety degree of under eyes PLLA injection. I avoid the PLLA injection in infraorbital region for immune response reaction. We can use polydeoxyribonucleotide and salmon DNA or hyaluronic cross-linked or non-cross-linked, but never ever inject PLLA in under eyes.
Okay, another question, the massage 555 technique to help to avoid nodules.
Yes. I said in my last injection, we massage during injection in clinic, and also asking my patient for home massage for 5 times for 5 days.
Okay, another question, how to manage glaucoma if occurred?
We don't use PLLA first in under eyes for avoiding glaucoma incidence.
Okay, and for the last question, when to use PLLA and when to use calcium HA?
For me, I prefer use PLLA in face, and I recommend use calcium hydroxyapatite for hands. for immediate volume results. It acts like a scaffold for hands rejuvenation and also hidden veins and tendons, and restore youthful volume.
Okay, thank you so much, Dr. Muhammad. It was a really great session. Thank you for your time and thank you for your effort.
Thank you.
Thank you. Thank you so much.
Hello. Are you hearing me correct?
Hello, Dr. Dani.
Hi, Miriam.
First,
Good evening,
introduce and to welcome you for the first time with us, Dr. Dani Isa.
Yeah, thank you.
Dr. Dani is a general practitioner and aesthetic clinician. We are delighted to have you today with us for the first time in our webinar, and we are really excited to hear from you.
Thank you very much for the introduction, and it is my pleasure, of course. So good morning, good evening, everyone, and thank you for being here. Thank you, Miriam, and my fellow panelists for making this possible. Like I said, it is a great pleasure, and I should share my screen first. So just give me. Okay, so is everything clear?
Yeah, it is.
Perfect. I won't be talking today about a specific product or a protocol, and instead I thought to myself, why not step back and discuss a broader mindset shift in aesthetic medicine. So for a long time, the field was majorly dominated by the idea of visible correction. So the thought process was fill the wrinkle or replace the volume or just relax the muscle. But today, especially with what we have as options and technologies, this conversation is somewhat changing. So we are considering not only what can we add to the skin, but we're acknowledging what does the tissue really need? What does it what is it lacking in terms of supports for its own physiology? And that's how we should get more natural results, more personalized results, and of course, more sustainable. And that explains the idea behind my title, which is From Correction to Biological Support. Okay, so many features we do actually call beautiful in our day-to-day, so are actually features of healthier tissue. So we do know elasticity of the skin hydration or moisture. We appreciate an even skin tone, and when the collagen is organized in a good way, it shows as a firm and tight skin. Even when the inflammatory process is under good control, so scarring and the overall look is just better, and we just say, oh, it looks beautiful. So the old question we had before was, where's the defect and how can we hide it? So don't get me wrong, this is still valid. If a patient truly has a structural volume loss, we may need to restore that volume using our usual techniques and injectables. Or another example, if the patient has dynamic lines, so neuromodulators are still doing great work, as well as surgical indications that are sometimes of great use. But the new question we were asking ourselves is, how can we add another layer? So what does the tissue need biologically to function and remodel better? This mindset is what stands behind regenerative medicine and regenerative aesthetics. So we're not abandoning correction per se, but we're making correction more biologically inclusive. So the classic aesthetic model in visible correction it has somewhat of a clear binary logic. As I said, we see a wrinkle and then we think to ourselves, okay, you either fill or relax. Maybe we do have some volume loss, so we just say, let's replace that volume. Or there's an issue with pigment or skin texture, so we think to ourselves, okay, resurface the skin. This model, once again, is not wrong. In fact, it has been the foundation of aesthetic medicine and aesthetic practice. And so far, it has given us reliable results when applied correctly, of course. But this thought process becomes, you can say, incomplete since nowadays we have new options available to us. So we're not only talking about a static object, but on the contrary, the skin is a very live tissue. So there's, not only skin, but there's fat involved, there's blood vessels, muscles, and we don't neglect, of course, the immune cells and the immune system underneath. We do have also the extracellular matrix that's working underneath. So all of these make this a living and active tissue. And all of that actually is what supports the repair capacity to face the aging process. So the problem with a purely corrective mindset is that it may treat the end results without really asking, why is the tissue changing in the first place? Okay, so aging, we do know that it's not just a single problem. When we talk about aging, sometimes we refer mostly to the visible results of that process. And it is mainly due to a lot of stressors that we endure every day, such as UV and UV lights and the damage they cause to the DNA and also our collagen pool. There's also weight changes that may cause that skin laxity or skin changes in its firmness, as well as just chronological aging. So the fact that we're aging naturally, fibroblasts activity and extracellular matrix renewal is naturally decreased. So this is why the idea of health equaling beauty has truly a biological basis behind it. So naturally, a skin that is protected from those stressors like inflammation or UV rays, like it's truly gonna act better and it will usually look more youthful naturally, and can recover better from those stressors. So on the long run, it functions as it should correctly. And we can say that preventing or preserving these processes and supporting the tissue from underneath to the top are not separate from aesthetics, and they make a great part of aesthetic medicine. Okay, so this is somewhat the key idea I'm trying to get into. The body already has its repair system, so it can create inflammation on its own. It can recruit fibroblasts on its own. It forms collagen. It recruits and remodel the extracellular matrix as it should. It builds new vascular support and repair the skin barrier when injured. So nowadays, for us, as professionals, our clinicians' role is not to always provide the final byproducts, but sometimes we should give the correct signal to direct the body and so that it can produce the right response that it knows best. And it somewhat changes the way we think. So we become less like decorators who just add material to the face, but instead we're more like clinicians and doctors who diagnose first the tissue's need and guide that tissue response. This is why nowadays in all the fields of medicine, we're talking about a personalized approach, and it does matter. So when we talk about a visible line or fold, it may present in a different underlying problem depending on the patient. And in this topic, this is where biostimulators fit exactly this mindset shift, because they're not only space-occupying products. So unlike traditional fillers, for example, that mainly provide immediate mechanical correction, biostimulators actually are aiming to trigger a controlled biological response, but that thing happens over time naturally. And the main idea behind it is activating the fibroblasts, recruiting that collagen deposition, and enhancing the vascular bed underneath. And so you can say that the product is not really the whole results, but the patient's own biology is a huge part of that treatment. So as they mentioned before me, and I believe you do know, that we have a few categories available of biostimulators, like polylactic acid or calcium hydroxyapatites and the others. So we do know that they're not identical to each its indication, to each its time of reversibility, for example, or risk profile. But the whole idea is that, once again, the concept is similar between them, and they all prove this shift from simple replacements toward guided tissue response. And this reiterates the fact that patient selection becomes even more essential in our practice. When we say that health equals beauty, this gives us a practical framework, actually, though. So this is an idea that we can use in our daily practice, because naturally texture is going to improve when the skin barrier is working just fine and it's repaired and it has enough collagen stores to work with. We do know that, for example, glowy skin or hydrated skin is going to be achieved when that skin barrier keeps the moisture inside. We do know that we're going to have better scarring results and better wound healing overall when the collagen remodeling and vascular control is working just fine. So long-term aesthetic results depend greatly on these processes, and that's why we have to support them, okay, and maintain these processes working just fine, and not only thinking about a single session correction that shows immediate results. And this is important because patients often come asking for just one visible problem. So you do know they might come and say, I need filler here, or this thing is bothering me. And it is our job to actually evaluate and diagnose what's the real issue behind it. So that in a way, our best results will not only be a younger shape, but also having a healthier and better functioning tissue. So this is as a quick example. Let's say these 3 patients come in and they all complain from the same thing. They say, hey, doctor, I look tired. But then with your professional eye, you're gonna take a closer look. And in the first one, you would actually see that there's clearly some volume loss, but her overall skin quality, or the patient's overall skin quality, is actually doing pretty good. And in this case, we may favor our usual injectables. But in the other hand, we have the second patient that, okay, you would see that there's minimal volume loss and that the skin quality is somewhat in need. In this case, biostimulators have a better advantage, so we would favor them as a beginning treatment. But then there's also a case where it is somewhat, the concern is different. For example, in the third patient, where the idea or the complaint of looking tired is coming from a dysfunctional skin barrier, and she has a problem with pigmentation, or there's an inflammatory process underneath. And this is why we cannot say that we are looking into just creating just one product for every concern, but we should mainly focus on real tissue diagnosis first, and we should not automatically give the same byproducts. And we should always be asking ourselves what the tissue really needs physiologically, so that we can support it. And then once again, I go back to biostimulators because they do confirm our long-term mindset, our long-term approach. So our first objective is obviously, when working, is to protect what we have, whether by UV protection, using sunscreen, using daily moisturizers. Then we can think about how to support the underneath structures and support the collagen and extracellular matrix. And this is where biostimulators work perfectly, as well as some energy devices that we do have. Then we can think about the corrections and the contouring we usually do. And of course, we should not forget about the follow-ups, the before and after pictures, and the regular visits that come. So you can say that this is why modern aesthetics are becoming more longitudinal. So we're always thinking about a plan, not a procedure. Okay, when we talk about supportive therapy, supporting physiology, we still have to be careful, because biology sure is powerful, but never risk-free. To be honest, nothing is risk-free. So natural does not necessarily mean safe. Collagen stimulation does not mean complication-free. We do know of some common risks of using such treatments. So we still have to be on the safe side. And to do so, communication is actually the key. Patients might hear words like natural, or regenerative collagen banking, or cellular activation, and they may assume that the treatment is simply risk-free, which is not true. But our responsibility is to actually translate that marketing language into true medical language, so safe language. And should always be asking ourselves, what is the indication? What is the evidence behind this? What are the risks, and what can and cannot be reversed? So the rule is, do not let the trend wave or the language move faster than the actual evidence. So we could use this as a treatment or a practical framework in our daily practice. Since treatments are getting more personalized in our, so our approach should follow naturally. We look at the patient's biology, we dig deep in his or her medical history. We then go to confirm that diagnosis. Is it truly volume loss, or maybe it's skin laxity, for example? So then we know what signal we should be working on, what we should be supporting. And for that, we do have a few other options. We do have our devices, or our usual products. And then there's the most important of them is the final two, which are patients' approval and patients' understanding, because they have to be actively involved in the last step, which is the follow-up, okay? And this framework keeps us from becoming product-centered, but instead it makes us diagnosis-centered. And that is the difference between selling treatments only and practicing aesthetic medicine. I will close with this message. So modern aesthetics is not abandoning correction, it is adding biological layers to it. So there's levels to this, okay? We are steering away from doing more to the face and into being smarter with the tissue we do have. So a good word would be we're being resourceful. And biostimulators are great, not only because of the product itself, but because they force us to think differently. So they remind us that the patient is not just a surface to correct, it is a living tissue with its own physiology, its own repair systems, and it can manage inflammation on its own, and it has his own individual biochemical reactions. So if we respect that, we can create results that are more natural, more preventive, and more responsible. And I think this is what would be ideal. And thank you very much. I know it's the end of the day, it's the end of the week, so I hope I wasn't too overwhelming. And thank you for having me.
Thank you so much, Dr. Danny. It was a really great session.
You're welcome. Thanks.
Very
My pleasure.
Thank you so much. And now the Q&A session, and we have already a very great comment from Prof. Dr. Mustafa saying that healing is a matter of time, but it's sometimes also a matter of opportunity. And this is a famous quote attributed by the ancient Greek physician Hippocrates. Rest, nutrition, mindset, prevention, action, care, hydration, sleep, exercise. Thank you
Of
so much,
course.
Dr.
Yeah, my
Mustafa.
pleasure. Thank
Okay,
you for
now
having me.
we have some questions for Dr. Danny, please. So the first one, it's from Prof. Dr. Mustafa. Behind any medical new technology, there is evidence-based medicine. What's your take-home message for us in terms of daily learning and sharing with peers?
Okay, so if we had to take just a message, I would advise to remain on the safe side, to practice evidence-based medicine. So we are doctors before everything else. So patient safety should be above all the treatments. We should be the ones that say no to this treatment or no to this approach and redirect patients' expectations of treatments so that we get longer results, more natural results. And that is how I would say, or at least in my experience, patients are more receptive and they do follow that treatment plan instead of a treatment session.
Okay, great. Does anyone have any question? You can write it in the chat box. Everyone is thanking you. Thank you so much, Dr. Danny. It was a really great session.
Well, likewise, thank you for having me and have a good weekend.
Thank you for your time and effort. And now we are going to have a very short break. And during this break, we will be streaming a video about one of our highly requested courses, which is the NanoFat Masterclass. And if anyone wants to join our upcoming NanoFat Masterclass, you are going to find a link attached in the chat box. You have to just fill it, and one of our team is going to contact you to give you more information and more details about the course. Thank you.
شبیه میگم شما میتالله کار میکنی شب که ما نام میکنی مزیترم کوشش میکنم که میشه که
Hello?
Hello.
Okay, and now we are delighted to welcome Dr. Fos Rostress from Jordan. Dr. Fos is a dermatologist trained in Italy and holds a master's degree in laser therapy from a university in Italy. She's also a trainer in advanced aesthetic injection techniques, a key opinion leader in biostimulators and regenerative medicine, and an international speaker in the field of aesthetic medicine. We are honored to have you today, and Dr. Fos is going to speak with us today about the death of the done look. Dr. Fos, welcome.
Hello?
Hello, Dr. Fos. We are really happy to have you today.
Just, okay, just a moment.
Take your time, it's okay. Dr. Fos, are you ready?
Can you see the,
Yes, we can see your presentation, but now you turn it off.
what happened?
Yeah, now we can see your screen and we can see the presentation.
But can you, okay. But can you see, can you also
Yes,
see?
yeah, we can see you and we can see the presentation.
Okay. Hi, everyone. I'm Dr. Fos Rostress, and thank you for inviting me in this webinar. It's been very useful. Today, as we already know, we're going to talk about the biostimulator and all new in regenerative medicine. My presentation is going to be about the death of the down look. I don't know if most of you can understand what's the meaning of the topic, but as you can see, I wrote already under it the CPR. And why is that? Because for the last years, since 2020 till now, we saw so many tragic trends in the field of the aesthetic. As the doctor already said before, one of those tragic and disaster was our field face using so much fillers for recovering or camouflaging the problems in the face of the patient. Then in 2023, we start to see another tragic problem in aesthetic, and they called it Ozempic face. Ozempic face is using the GPL1 anti-receptor for losing so much weight in the short period of time. And why is that important? It's not only because you're losing fat mass and the face is sagging down, but also they found out that GLP-1 is also decreasing indirectly the estrogen and furthermore decreasing the collagen. Also, by depleting the white fat underneath of the skin, we're going to lose so much of reservoir of fibroblasts. And as we already know, fibroblast is very important for producing the collagen. And this is where the biostimulators and regenerative medicine hit in. I prefer, because this is what I think usually in my clinic, I prefer to make this presentation a little bit more practical because I believe most of us, we are like having difficulty to choose the right product for the right patient. And there is so many biostimulators, new products in this field. And choosing the right product for the right patient, I believe it's the cornerstone of any clinic and any good practitioner. So, with the note of changing the concept of the aesthetic from filling to volumetric biostimulation and regenerative treatment, let us start. All of us already know what's the process of the aging and how does it work. And what's the role of the fibroblasts in process of the aging. That's why biostimulators, they took a bigger space in aesthetic medicine. For making things more easy, I love to divide the biostimulators in two main different types. One are polylactic acid, which are underneath is PLLA, like Sculptra, PDLLA, and PCL, and also the threads. I believe most of us already know the brands and the products. Another big one is the calcium hydroxyapatite. And also, I would love to introduce you to a new product, which is based on hyaluronic acid, which actually also work as a regenerative medicine. But of course, at the end of the webinar. So stay tuned. How we can choose among our biostimulators? As I already said, let's just divide them as two main products, polylactic acid and calcium hydroxyapatite. Polylactic acids, underneath, there are two main products. One is the PDLLA and the other one is PLLA. The difference between the molecules make the difference how the products react and also the complications. As most of the doctors already said through this webinar today, dilution of the PLLA is very important for the result and also to avoiding the complication. Why is that? Because as we can see in this picture, PLLA, it's a crystal and diluting it, it's not easy. On the other hand, PDLLA, they are microsphere, and with so much pores inside, which make them a little bit more easy to be diluted. As we can see in this agar jar, the dilution of PLLA, it's mostly more amorphous rather than the PLLA. These are a table, a difference between the different type of the biostimulators, which you can welcome to make a picture of it. I want to notice you. I want you to focus on the size of the particle of the products, because the particle size is also a very important, let's say, very important sign of the how the product's gonna react in our body. When we having a smaller particle size like PCL, the inflammatory process gonna be higher than the other products. To be a little bit more systematized, going back to the polymers, PLA, as I already said, the difference between the PDLLA and PLLA, one is being the PLA being crystal. That means when you want to dilute your product, you need a little bit more time and you should be more patient. Plus that you cannot put your product in the mid phase. On the other hand, the PCL is very easy to be diluted. Plus, they are smaller in size, and they are making a little bit more of inflammatory process. Another big difference, how we can choose our product between the polymers and the calcium hydroxyapatite. Calcium hydroxyapatite, they are recognized for being less inflammatory process during when you're using a product. They are gonna make less inflammatory process. And why is that important? Because first of all, you can use them also in the patients with autoimmune disease, and there are so many researchers recently about using the calcium hydroxyapatite for dermatological diseases like scleroderma. And plus, they are producing a little bit of more elastin rather than the polymers. As I already said, the dilution is very important. There are 3 ways to dilute your product. Here, I'm talking mostly about the polylactic acids. You can shaking it using your vortex if you have it in your clinic, or back and forth. And please, again, when you're using the PLLA, try to put more time to dilute your product. And if you've been with us in the beginning of the webinar, in the first session, the doctor already said that how you can differentiate between the good diluted PLLA and the one that could make you problem. Dividing the complications of the biostimulators, they're gonna be, because so many doctors, they only ask through the webinar, what are the complications? The complication, we can dividing them in the inflammatory complication nodule and non-inflammatory nodules. Non-inflammatory nodules, mostly it's using the product wrong, in the wrong plane, or diluting them not in the right way. The researchers shows the speed of the injection of the doctor can also have a very big role in producing the nodules. Because as we already know, when you're using your biostimulators, it's better to use cannula 22 gauge, and the technique always being retrograde. When you're using your product fastly, or you're being fast in your clinic, probably you put much more of the product in one place, and that's gonna end up with the non-inflammatory nodules, which is the most complication of the biostimulators. So please, when you're using your biostimulators, take your time, have a breath, and give the patient enough time. The other complication, the other thing that lead to the complication with the biostimulators especially, is placing your product in the wrong layer. Some, unfortunately, placing it in muscles or in the movable area like around the lips or underneath of the periocular, which also gonna lead to make possibility of making more nodule formation. If you're having this question that when to use your biostimulators, before or after the Botox, because I believe so many doctors also doing the Botox in the lower part of the face, some calling it Nefertiti. So if you want to know when you use your biostimulators, the best in the research shows the best that you use your biostimulators a week after the Botox, that you applied the Botox for the patients. So the tips and tricks, so the tips and tricks. So the tips and tricks, as I already said, first, dilution. You should dilute your polylactic acid with the water for injection, dry water for injection, and your KAHA with the normal saline. As the doctor Oldie from Korea said, there's a big study about if you dilute your polylactic acid with normal saline, the ending up solution is not going to be homogeneous enough. The other thing, the polymers, it's true that they are control inflammatory process, but at the end they are making more inflammation than KAHA. So preferably for the patients with the autoimmune disease, even if their autoimmune disease is subtyped, it's better to use KAHA rather than the polymers. The other thing is the thermal resistance of the product. KAHA, there are more thermal resistance, and that gives them the possibility to combine your product as a biostimulator with medical devices like HIFO or radiofrequency microneedling, which can do it at the same sessions, because as I already said, KAHA, they are more thermal resistance. And another good point for how you choose your patient, going back to the research of 2025, polylactic acid in general, they're not only working on collagen type 2, collagen type 3 and type 1, and that as we already know, they're also working on collagen type 4 and 5, which are enhancing the adipose cell. So basically, it's better to use the polylactic acid on more lax patient with more fat, with less fat in their face, or let's say just thinner patients, and your KAHA for the patients with more mature skin and more wrinkles, because as we already said, they are producing more elastin rather than the PLA. And PLA, they are bringing the adipose cell in, so it's better to to divide your patient, the one with the fat loss, probably, and more laxity, more mature. They are probably better candidates for the polylactic acid And the patient with the thinner skin, more wrinkles, they are better candidates for the calcium hydroxyapatite. In the previous years, they also had a new technique. They called it hybrid technique. And I believe most of us know what is the hybrid technique. Hybrid technique is actually combining your biostimulators with the hyaluronic acid. You can combine all of your biostimulators with hyaluronic acid, but here in this webinar, I'm gonna talk about the biostimulators that actually they have researchers about mixing them with the hybrid filler. Kaha, they came with this big research like couple of years ago about how you dilute your product, calcium hydroxyapatite, with the hyaluronic acid. You can dilute it with cross-linked hyaluronic acid and also non-cross-linked hyaluronic acid. And the researchers shows not that only using the hyaluronic acid as a hybrid technique in your biostimulators can give you more volume at the beginning, because as we already know, seeing the volume when you're using your biostimulators needs a little bit of time, needs months to reach the volume. And that was the point that so many patients, they couldn't understand. Hybrid technique plus that can also show the patient instant volume, but actually after a month, during the showing by these studies, they are actually producing more collagen. Plus, as I already said, you can combine it with the energy devices. You can also hybrid over polylactic acid with the filler. And I prefer you always go back about the how to hybrid and the dilution, especially as a hybrid technique. Go back to the product that you're gonna use, and plus the anatomy, of course, and the place that you're gonna put your product. For example, if you're gonna use your product in more thin skin, you should hyperdilute it more. On the other hand, in thicker skin, you can also use less diluted product. So please take your time again and choose the right patients. Another part of this webinar, I'm gonna talk very fast about the regenerative treatment and the new things hit into the market. One, and which I believe that everyone, all of you knows, is the exosome. Exosomes are actually microvesicles, as we already know. They are working as messengers between the cells. They've been in the market for a long time, but maybe they hit in the dermatology and aesthetic field lately. The exosomes, they are basically divided grossly into 3 types: from planet exosomes, synthesized, and human exosomes. There are so much study about which one is safer and the difference between them. Okay, so but here, let's say in the Middle East and Europe, we are using mostly basically planet, not human exosome, and the animal exosome, because researchers shows that they are safer. The technical or clinical point about using your exosome is a depth. Besides of choosing the right exosome from the right company and the right product, you should be in the right depth so that your exosome actually work. That's why you don't need to be so deep, and using the microneedling 0.5 to 0.75 millimeter is just enough to deliver your exosome. Plus, if you want to combine your exosome with the other energy device, please preferably wait for the skin to be cooled off, minimum of half an hour or 20 minutes. Then you can apply your exosome. Of course, I believe the combination therapy is the best way to make your patient satisfied. The other one, which let's say new in the market, as you can see, I believe everybody know what is it. It's PDRN, PDRN. They are taken from basically from salmon and working and as mRNA. Also, again, the depth of your product is very important, and no need to be very deep. You can use it. You can also use them with the needle on the right depth, and combine it with many other products. And in the market, we see lots of product combination of the biostimulators, hyaluronic acid, and PDRN. So if you want to use or combine your PDRN with your biostimulators and hyaluronic acid, you can do it, go ahead. But I prefer to don't mix and match them in the same syringe. You can do them in the same session, but preferably not in the same syringe. And actually, there is another study from Maher putting the PDRN in the radius, and because there is a pH difference, the results could be not as good as using them separately. At the end, I want to talk very briefly about a new product, which is also working as kind of biostimulation and regenerative, but it's actually based on hyaluronic acid. This is a new technology called cross mineral, which is using hyaluronic acid based filler in alkaline water. So it's basically 97.5 alkaline water with only 2.5% of hyaluronic acid, 2 different molecular weight. And why alkaline water? Because as we already know, alkaline water, they are containing so many ions. And these ions actually, they are very important in our skin, working as anti-inflammatory. They can regenerate, and this type of new fillers could make it saving us years going back and for regeneration of our skin, and also filling up. And thank you so much. And sorry if some of the slides didn't work, because there's actually videos in this webinar in my slides, and it seems some of the videos didn't work. Hello?
Thank you so much, Dr. Fos. It was a really great session.
Thank you, dear.
Thank you so much. Thank you. Okay, and now with the Q&A session, if anyone has any question, please write it in the chat box. Okay, we have a question. If biostimulator done in combination with PDRN, which has to be done first?
Actually, you can do them in the same session. I was only saying putting them in the same syringe based on the study from Merz. It could not be a very good idea because the pH of the products are different, but you can do them in the same session. And plus, as I already show, the depth of the product is different. So you can do them in the same day on the same sessions, but preferably not in the same syringe.
Okay. Okay, another question. A doctor is saying she's a beginner. Can she use a good mesogun with retrograde injection option?
Okay, first of all, congratulations for finishing your medical school and being a beginner. Welcome to this field. Actually, I never heard about mesogun and retrograde, because retrograde, I don't know what you mean with the mesogun retrograde, but retrograde, when we are speaking about retrograde and biostimulators, that means you are using a cannula, blunt cannula of 22 gauge. I use in my clinic 70 millimeters because it's longer and you can reach most part of the face easily. So retrograde, using the phrase of retrograde and biostimulators, that means you're using a cannula of 22 gauge preferably, and please don't use the cannula less than 23, because the cannula less than 23, it's almost the needle, and it's gonna make sometimes disaster. Retrograde means you're using your cannula and putting your product, which is biostimulators, retrogradely in in your right plane. So mesogun, it's not gonna work. Mesogun means the device that you can put your, let's say, maybe exosome or your mesotherapy. It's not working for the biostimulators. One. The other thing, because you said she's a beginner or the doctor is a beginner. If you're a beginner, please dilute your product evenly, and you can also dilute them more. Like, for example, because this is the point, I didn't put it in my slides. I believe that so many doctors, because all of us are going to talk about the biostimulators, and some doctors, they already said how you dilute your product and how much you should add up your normal saline or water for injection. But if you're a beginner, please, you can dilute a little bit more, so you're going to be in the safer side.
Okay, another question. What about the depth of exosome for the hair, and what is better to be delivered with needles than microneedles?
First of all, this is a tricky question because using the exosome, actually, you should be all the companies, they just written that you should use your exosome with dermapen, which is good enough, because as I already put it in the slides, the depth of the 0.5 millimeter or 0.75 millimeters is more than enough for you to be in the layer that the actual exosome gonna work. I know that using the dermapen for hair, it's a little bit difficult. But on the other hand, I cannot tell you that you can use your needle, even if I'm using it in my clinic. Please choose the right product, especially with the exosome, because not all the exosomes are safe enough. I believe that most of the exosome in our country, let's say in our region, it's difficult to have not CE marked exosome. But also choose the right product, especially if you want to inject them. Because some exosomes, if they are not pure enough, or the stabilizer inside them, it's not, let's say, pure enough, can make a big inflammation, especially if you're gonna using them with a needle.
Perfect, doctor. Another question. She's asking which procedure to be done first, if done on the same day, PDRN first or biostimulator first?
Okay, it's almost the same question. To be honest, doesn't matter. But if this is what I do in my clinic, and it's not a must. But because biostimulators take a little bit of time, for preparation. If you are not talking about KAHA, because KAHA it's very fast to be reconstituted. It's faster than the PLA, polylactic acid. So if you are using your polylactic acid, or you're planning to use polylactic acid with a PDRN, this is what I do in my clinic. It's not a must. Again, I start to prepare my polylactic acid. And at the same time, I do inject my PDRN. So when I finish, I was my polylactic acid constitution be almost done. It's only because saving the time, not anything else.
Thank you so much, Dr. Fos. It was a really great session. Thank you for your effort and for your time.
Thank you.
For answering all the questions.
Oh,
Thank you. Thank you so much.
thank you so much.
Thank you.
Hello? Hello?
Hello.
Hello? You hear me?
Hello.
Hello?
Okay, and now we are delighted to welcome Dr. Maher Solah. Dr. Maher from Egypt. He is a consultant dermatologist and aesthetic expert, medical director at Anara Clinic in Dubai. He's also an instructor with us in the American Association for Advanced Lips course, and we are really happy to welcome him today in our webinar. He's going to speak with us about fillers are the present, biostimulators are the future, and he's going to give us all of his expertise in this field. Dr. Maher, can you hear us?
Yeah, I hear you, but I'm just trying to share my presentation.
Okay, take your time, no worries.
Microsoft PowerPoint. Share. Mm-hmm. You see my presentation or not yet?
No, not yet.
Not yet. So again, share content only as background over the shoulder, share sound. I should share my desktop or the Microsoft PowerPoint. Let me try that. System setting. I don't know. There's a problem sharing. Not yet. Share.
Not yet.
Here it is. Here it is. Yeah.
Oh,
Yeah.
yeah, now we can see the screen.
Okay. So you can see a full screen now, right? You see the presentation now, right?
You can see.
Okay. So yeah, this is my presentation, not my son presentation, and let's have some fun. We heard to a lot of heavy meal before my presentation. So let me start with talking about fillers and biostimulators are two superheroes in our aesthetic practice. And recently, it is looking like both of them are in a big fight. And a lot of debates on different levels still going on, from the level of experts to the level of social media audience. To introduce myself, I'm Dr. Maher, a dermatologist and aesthetic expert for almost the last 2 decades. I'm originally from Egypt and at the moment based and practicing in Dubai. And I'm here today to help you clarify the aspects of this conflict between fillers and biostimulators. And during this 30 minutes presentation, we will learn about, actually, just a moment. It's not trying to change the slide, but yeah. Okay, so this is a brief about me, and this is a QR code for my contacts in case if you want to scan it and keep in touch. Our presentation today is titled Fillers Are the Present, Biostimulators Are the Future. And through this 30 minutes presentation, we will try to understand the evolution and complementary rules of fillers and biostimulators, compare the mechanisms of action, advantages and disadvantages of each and limitations, and analyze the market trends and social media influence, and recognize the power of combination therapy. Fillers and biostimulators are partners or competitors. This is a very important question. Different mechanisms of both are addressing different aspects of, so different mechanisms of action and different aspects of aging will guide us, which product is suitable for each patient. We will see or put volumization and tissue regeneration always in front of our eyes to decide which is suitable for every patient. We should think about immediate results or gradual improvement, and we'll see if there is a complementary or mutually exclusive characteristic of each. Talking about the aging process is a multifactorial process that requires multimodal approach. And when we look at the aging process in the face, the fat bads are changing, decreasing in volume, sagging with gravity, with the effect of gravity. On the surface of the skin, the collagen is always going down with age, especially and earlier in females compared to males. Even bone resorption and bone changes share in the total aging process. Why this matters now? Because there is an exponential growth in aesthetic procedures, patient demand for natural and long-lasting results, and the evolution from the idea of filling to regeneration, and shift towards preventive aesthetics, or what we call it now, prejuvenation. Let's talk about, briefly about the history of both fillers and biostimulators, and this is very interesting. From 80s to 90s, there was the bovine collagen era, Zederm, okay? It was an animal collagen filler. And then the era of hyaluronic acid revolution started from 90s to 2000 by mainly the big names Restylane and Juvederm. And then after 2000, the introduction of biostimulators has been started, especially PLLA and KAHA. And in 2010, there is more understanding of the characteristic of these products and the recognition of the dual mechanisms and combination. Talking about the collagen era, first FDA approved injectable was or bovine collagen was Zederm, and it required the test, some skin testing because it's of course of animal origin. And the duration of action was around 3 to 6 months, and this was a limitation that led to searching for alternatives. Then the hyaluronic acid revolution began with non-animal derived, no skin testing is required, and it's one of the advantages that it's reversible with hyaluronidase. And it has an immediate volumizing effect that lasts comparatively longer than the animal origin collagen fillers. And at the beginning, hyaluronic acid has been introduced as just a space filler only. Then biostimulators emerged in the market with PLLA, which is approved 2004 for HIV lipotrophy, and then calcium hydroxyapatite, which is approved 2006, and PCL also, which is more recent addition, and many others. But I will talk about the most famous and common choices of biostimulators. I will not go into deep details. I think my colleagues, I should thank them all because they went in depth and discussed a lot of details about the products. Then the paradigm shift and the blurring of categories. So now you can't distinguish completely between these categories because each category has different characteristic or multiple faces. So in 2007, that there was the first evidence that HA fillers can stimulate collagen production. Then the recognition that fillers have a biostimulatory effect and recognition that biostimulators also provide immediate volume, and categories overlap more than previously thought. Actually, some biostimulators are originally fillers, and this is the truth. So, biostimulators were originally fillers. Fillers has some biostimulator properties. So here is the blurring or the multiple faces of each product. So Kaha, even myself, maybe more than 10 years ago, it was used only as a filler, as it is, without dilution. We were just adding some lidocaine and injected. And it was my products of choice for defining the jawline and chin area. PLLA, actually developed for volume restoration in HIV lipotrophy. Both later recognized for collagen stimulating properties, and dilution techniques expanded their application. Current landscape. Multiple HA formulation with varying rheological properties makes it more, covering more indications. The established biostimulators, PLLA, KAHA, and PCL, has been frequently used, and now we have better understanding of these products. The emerging hybrid products that combines HA with dextranomer, like Genifil, or HA with KAHA, like Harmonica from Juvederm recently. We are lucky to attend the soft launch of the product here. That makes us now not too much in need to individually mix and put this product over this product in one syringe and inject it. Now we have hybrid product which is ready to be used without any extra dilutions or extra preparation. The growing evidence for combination approaches. Let's talk briefly about HA fillers, pros and cons. For sure, the most important advantage about fillers, the immediate predictable results. Reversible with hyaluronidase, excellent safety profile. There is a wide range of rheological properties for different indications, and the hydrophilic properties of HA fillers improve the skin hydration, and it has some little collagen production or collagen stimulation effect. But on the other hand, the disadvantage include that it's temporary, but it's actually satisfying. 6 to 18 months is mostly satisfying most of the patients. Requires repeated treatments, quite higher cost over time. There is a risk of vascular occlusion, but it's rare. So it's rare but serious. Tyndall effect and some other common side effects may happen also. And it doesn't address underlying tissue quality as primary mechanism, unlike biostimulators. The mechanism of action of HA fillers depending primarily on immediate volumization through space filling, simply. But the secondary mechanism is mechanical stimulation of fibroblasts, hydration, and being hydrophilic substance for the extracellular matrix, and some modest collagen production, and the duration is limited by enzymatic degradation. Clinical application, no need to count. It's applicable everywhere nearly. Evidence summary about the fillers, 90% plus patients are satisfied in most of the meta-analysis. Superior duration compared to collagen. This is from the past. Common adverse events include swelling, nodules, and pain. Severe complication, rare but serious, and we should take care about it. Now, on the other hand, biostimulators, pros and cons. The advantage that it's longer lasting, okay? Talking specifically about PLLA, which is the longest lasting. It may extend to 2 years or 3 years maybe in some cases, but KAHA may be around 12 to 18 months, similar to fillers. The gradual natural looking improvement, which is favorable for some clients. It stimulates endogenous collagen production and improves skin quality in general, in means of texture and elasticity. It's cost effective over time and addresses tissue quality, not just volume. On the other hand, the disadvantage that it has delayed results, which matters for some or certain types of clients, requires multiple treatment sessions, not reversible, higher initial skill requirements. I don't totally believe in that. I think filler injection needs higher skills. Risk of nodule formation, unless it's a high risk and nodule formation with biostimulators is one of the main fears of any practitioner. But actually, the incidence of nodules with biostimulators may be less than fillers. And it cannot provide immediate volumization alone. The mechanism of action regarding PLLA, it's biodegradable synthetic polymer, triggers a controlled foreign body reaction through M2 macrophage polarization and TGF-beta1 mediated fibroblasts. So it goes through the inflammatory pathway, and it leads to sustained new collagenesis, and which is unique for PLLA, adipocyte regeneration, and the duration may be up to 25 months. Talking about KAHA, it's microspheres in gel carrier, which is CMC, carboxymethyl cellulose. It has an immediate volumization from the carrier gel, CMC. So the immediate volumization is related to the gel carrier, not the calcium hydroxyapatite itself. Microspheres act as a scaffold for collagen, so it promotes a pro-inflammatory pathway activation and gradual, and it undergo gradual biodegradation and it lasts for about 12 to 18 months. The clinical application of biostimulators may be used as facial volume restoration, so we can restore volume with biostimulators, skin quality improvement, body contouring, post-weight loss restoration, including GLP-1 therapy, and it's very popular and trendy now in the market, rejuvenation for prevention, and it can be combined also with energy-based devices for optimal results. Evidence summary. Also, the satisfaction rate is very high, more than 90%. PLLA effects maintained up to 25 months, KAHA 12 to 18 months, and the common adverse events include pain, bruising, nodules, unless they are saying pain is 92%, but it can be controlled with adding lidocaine to the product while doing the reconstitution. Severe complications include granulomas, compression necrosis, and it's just case reports. Now let's move to the technical and practical comparison. And I have prepared some simple tables to compare HA fillers to PLLA, CAHA, and PCL. And let's take it quickly. Regarding if we are comparing the onset, for sure HA fillers wins. It's immediate. The faster of the biostimulators may be CAHA, and PLA, PCL may take longer time to start to show some good improvement. Duration and longevity, for sure, the highest longevity is for PLLA. Reversibility, HA fillers win. Primary mechanism, all biostimulators are mainly concentrating on new collagenesis. CAHA have an added value of volumization by the carrier gel, but HA filler mainly focus on immediate volumization. Number of sessions required. Fillers may need 1 session. You may maintain later with some other sessions, but not necessary. PLLA 2 to 3, CAHA 1 to 2, PCL 2 to 3. The skill level needed for each. According to the references, this is what I have found, but in my own opinion, I don't know if you agree or not, I feel like HA fillers is the most that need high skills to put a treatment plan and implement it. Comparing the clinical outcomes. So regarding the immediate volume, fillers wins. Skin quality, more for sure more with collagen stimulators. Collagen stimulator for sure with collagen stimulators. Natural appearance. Actually, both can achieve excellent and natural appearance. It's not depending, natural appearance is not depending on the product itself. It's more injector related. Patient satisfaction is high in all. About adverse events, let's see. So swelling, it's 60% with hyaluronic acid because of the hydrophilic properties. With biostimulators, it's a bit variable. Bruising, common, and 27.5% with biostimulators. Nodules, here is you may be a bit surprised, or some if we have some audience who are starting their career, they may be more concerned about the nodules that happens with biostimulators, unless you can see with biostimulators, it shows a 5% incidence. With HA fillers, it may reach up to 35%. So very interesting to know that. About pain, it's more with biostimulators. Vascular occlusion, rare and very rare with biostimulators. Granulomas, very rare with HA fillers and rare also with biostimulators. This photo, I found it very interesting to show you, since we are talking about the adverse events. This is a syringe with a 22 gauge cannula. My colleague, Dr. Fos, just before me, was talking about using smaller cannulas, maybe more dangerous, and it may cannulate the blood vessels, and the probability of intravascular injection may be higher. But imagine this happened with me while injecting Sculptra in the temple, okay, while moving the cannula before starting the injection. Suddenly, without aspiration, a gush of blood into my syringe, and as you see, even with a 22 gauge cannula, it may happen. It's very rare. I don't know if anybody of you has experienced similar event or not, but I just wanted to share that with you. Cost effectiveness analysis. HA fillers may be lower initial cost and higher frequency of treatment. Biostimulator may be higher initial cost but longer duration. Long-term cost comparison favors biostimulators, and patient preference varies based on priorities. Patient selection criteria. So how to choose your candidate, the best candidate. So the best candidate for HA fillers, if the patient desires an immediate result, first-time patient may favor HA fillers, specific volumization needs, and event-driven treatment. If your patient have an event soon, so they are looking for an immediate change. Cautious patients wanting reversibility, so HA failures are reversible with hyaluronidase. Best candidates for biostimulators. This will be for patients who are willing to wait for gradual results, have patience, seeking long-term improvement, and they focus on holistic skin quality, not immediate volumization only. Also for post-weight loss patients, GLP-1, Mounjaro, Ozempic patients, and for patients who are seeking preventive or maintenance treatments. What about market trends? Excuse me, I will just drink some water. So during the past 30 years, in 2007, 1.3 million soft tissue fillers procedures has been implemented in US. And after 10 years, in 2017, 2.7 million procedures in US has been done with 108% increase. And continuing growth through 2025 is happening. Shift from surgical, and people in general are shifting from surgical to non-surgical procedures. Market share evolution. So from 90s to 2000, collagen dominance, this is history thing, okay? From 2000 to 2010, HA fillers revolution, and then biostimulator growth emerged in the market, and then trends now is using both categories with growth expected for both categories. What about the demographic shift? So when we compare different generations, baby boomers are seeking traditional volumization and anti-aging. Generation X may look more for natural enhancement and minimally invasive procedure. Millennials are looking for preventive treatments, and they are very influenced by the social media, especially millennials. Generation Z are looking more for prejuvenation and temporary enhancement. Actually, all generations utilize both fillers and biostimulators. What about geographic variation? In North America, they found that HA fillers are dominant. In Europe, earlier biostimulator adoption. In Asia, rapid growth in all categories because it's considered a medical tourism hub. About regional preferences influenced by regulatory frameworks. Let's also talk about the future market prediction. What are the predictions of the future market? We are predicting continued growth in both categories. Hybrid products are gaining market share. Personalized treatment protocols and integration with regenerative medicine, such as PRP and exosomes. And then we'll move to the social media influence, which is influencing both sides, practitioners and also patients. The social media revolution, we all know that Instagram, TikTok, and YouTube are primary information sources now, even for us as practitioners. Sometimes we do, unfortunately, we do our research on social media instead of doing it on PubMed. So social media are very important nowadays. Nobody can deny it. 85.6% of top filler posts are by non-physician. Imagine the majority of top filler posts are done by non-physicians. Patient education increasingly from media, not only patient, even doctors and practitioners are increasingly educating from social media. Influence on both practitioner decision and patient demands. Social media impact on patient expectation. For sure, it increases the desire for Instagram-worthy results. When people look at the Instagram and social media and saw amazing results promoted there, and we can't deny that a lot of these results are unrealistic. Some AI tools has been used to improve the results, so it's influencing the expectation too much. Increased awareness of treatment options, and the unrealistic expectations and the demand for immediate and dramatic results, which is sometimes unrealistic, and the growing interest in natural aesthetics is beginning now again on the social media to replace the overfilled look. What is the impact of social media on the practitioner behavior? So marketing through social media platforms has affected a lot of practitioners, and it's a really good way for marketing. Before and after documentation culture and the pressure to deliver photogenic results. Let me focus again on this point, because everyone here, if you are dealing with social media marketing and you are used to have models at your clinics, and you have a plan to take a before and after photo of your results, so that puts you under pressure to achieve the most obvious and attractive results. Educational content versus promotional content has been increased, and we should keep an eye on the ethical consideration. The social media double-edged sword. What is the positive and negative influences? The positive influence of the social media includes increased awareness and education, destigmatization of the aesthetic treatments, and patient empowerment and authentic testimonials. But on the other hand, there is a lot of negative influences, which I think it's more than the positive influences, in the form of misinformation, off-label procedure promotion, unrealistic expectation, and pressure for excessive treatments. So the question, will HA fillers endanger or will disappear, or HA fillers are endangered in the market? And even companies producing HA fillers are, during the first few years, were a little bit relatively in panic and thinking about the future of their products in the market. The question is, are fillers being replaced? The answer for sure is no. And here's why. Because, as we discussed, different mechanisms between fillers and biostimulators serve different purposes. Immediate results will still highly valued and still be needed. Reversibility of HA fillers remains important safety feature. And specific anatomical indication for HA fillers like lips and tear troughs. And patient preference diversity. Evidence against replacement theory. So what is the evidence against fillers being replaced? Both categories are showing market growth at the last few years. HA fillers procedures continue to increase year over year, and new HA formulation continue to be developed, and the combination therapy gaining popularity, and there is no evidence of HA filler decline. The evolution, not revolution. What does it mean? So there is a shift from either or to both and thinking. So now we are not thinking I will use filler or biostimulator. We are more into both and. Recognition of complementary rules of both tools. Personalized treatment algorithms. And the integration rather than replacement. So it's better always to get the good benefit from each tool, and the expanded treatment paradigms. The future of HA fillers, will be continued in means of innovation in rheological properties. Hybrid products will take a market share, enhanced longevity formulation, and improved safety profiles, and integration with biologics like PRP and exosomes. A question also about biostimulators. Will biostimulators demand continue? For sure, we witnessed the high demand, the high increasing demand on biostimulators. But the question is, will biostimulators survive and continue their growth? The current biostimulators trajectory is looking for steady growth over past decade, increasing physician adoption. A lot of physician now favors biostimulators, but it's a big mistake to say only biostimulators and stop fillers. Growing patient awareness and expanding indications and evidence-based strengthening. What are the factors supporting continued growth of biostimulators? Aging population seeking natural results. Also, male clients are looking for more holistic, more gradual results instead of instant result or instant change. Cost effectiveness and the growing evidence of efficacy and the expansion beyond face, into body applications. Integration with other modalities and the post GLP-1 weight loss market, which is increasing nowadays. What is the potential challenges for biostimulators? Number one, learning curve for practitioners. You need to improve your skills in using biostimulators. Patient education and delayed satisfaction in instant results cultures. So some people don't favor to wait for a long time for the results. The competition from emerging technologies and the regulatory consideration and need for standardized protocols. We noticed throughout this presentation that every doctor has his own way, his own application, his own experience. Some favors injecting these biostimulator in certain areas of the face. Some other doctors are totally against. So there is some need to standardize the protocols. The power of combination therapy between both tools. Why combine? To address multiple aging mechanisms simultaneously, immediate plus long-term results, volume plus quality improvement, synergistic effect will be demonstrated, and enhanced patient satisfaction. Evidence of combination approaches include improved outcome versus monotherapy, enhanced skin texture and elasticity and contouring. Combination with energy-based devices shows promise. HA plus PRB demonstrates synergistic effect. Conclusion and take-home message to end this presentation. So my take-home message is in 5 points. Fillers and biostimulators are complementary, not competing. Understanding mechanism optimizes the outcomes. And combination therapy represents the future. Safety requires knowledge and preparation, and the future for sure is integrative. My final message, are you ready for it? Master post fillers and biostimulators. Understand when to use each, who is the suitable candidate for each. Impress combination approaches, which will be synergistic. And prioritize safety and education and stay current with evolving evidence and focus always on natural, long-lasting results and put patient safety and satisfaction first. At the end of this presentation, this is a happy end showing our two superheroes united, saying that the future is not fillers or biostimulators, it's fillers and biostimulators working together. Thank you so much. And if you have any questions, I'm ready.
Thank you so much, Dr. Maher. It was a really great presentation, and it was a very creative idea from you to differentiate between the 2 points.
Thank you so much. Thank you
So much. And now for the question and answer. If anyone has any question, please put it in the chat box.
Any questions? There is some.
Well, thanking you so much for the presentation and for your time.
Thank you so much. Thank you for attending this this webinar, and I hope that you enjoyed the presentation. And thanks is extended for all my colleagues before and after me.
We have some questions, Dr. Maher.
Yeah.
The first question, treatment for granuloma of PLLA.
So I think this question has been discussed before, but let's talk briefly about that. So talking about PLLA, we must differentiate between having an early nodule and late developed nodule. Okay, early nodules represents some accumulation of some product particles in a small space. So the best solution, if you discovered it early, is just to dilute it. Use some saline or water for injection, sterile water for injection, and try to dilute it and massage vigorously after the injection to try to spread the particles of the product again and avoid accumulation. So this is if it's an early nodule. If it's a late nodule, especially if it's multiple nodules, so it may represent a late hypersensitivity reaction, and it's considered as a granulomatous reaction. Steroids injection intralesionally may be needed. Hopefully you not face this situation, but it's extremely rare. In my practice, I have been injecting PLLA for maybe the last 6 years or maybe more. I have never ever had a single nodule after Sculptra or after PLA in general. But this is simply how to deal with it.
Okay, perfect. Another question, can HIFU be used in combination approach? If yes, how many days, period, or gap to be done?
For sure, yeah, combination of energy-based device, especially something like HIFU or Althera. These devices are using the ultrasound technology to deeply stimulate collagen at the S-mass layer. So for sure, it's working synergistically with biostimulators. There is no standard, specific gap in between, but I'm always conservative. I prefer always keeping longer gaps. Okay, at least maybe 6 weeks. Okay, in my opinion. Okay, or more. Okay, even when you repeat PLLA. Because these products are inducing a process of collagen stimulation and inflammatory process, so it needs some time for this inflammatory process to happen and calm down, and then you can introduce another modality to stimulate collagen. So I will say at least 6 weeks, if more, that will be better.
Okay, another question. What's the technique for hand and neck rather than face for KAHA?
KAHA specifically?
Yeah.
So again, what is the question? KAHA for hands?
For hand and neck.
For hand and neck. So for hands, in KAHA, this is by Maher's trainers. They always put a rule, they call it the palm rule. Okay? That means any surface area equal to the surface area of the palm of the hand needs one syringe. So this is the first step to determine how much product you need, okay? So when you deal with the hand, for sure you need one syringe for each hand, okay? And usually, if I'm looking for adding some volume and also improving collagen formation and improving skin quality on the long run, so I will reconstitute it 1-to-1, okay? But in the neck, no need for volumization. So I may reconstitute it 1-to-2, 1-to-3, okay? Make it very diluted just to improve or stimulate collagen formation on the long run.
Okay, perfect. Another question. Can we inject Sculptra at the same day of secret DUO session?
Secret DUO is a microneedling radiofrequency device, and also it has some sort of laser, I think, right? So if you are talking about microneedling radiofrequency, again and again, this is my behavior. I'm not, I don't like to be in a rush, okay? I will not, I don't think that there is any need to do it on one day. Why you are in a hurry to do it on one day? Do your biostimulator, okay? Wait for maybe also 6 weeks, and then you can do the microneedling treatment. Or if you will start with the microneedling treatment, actually starting with the microneedling treatment, you may wait for less time. You may need to wait for maybe 2 weeks to make sure that the healing process has been happened.
Okay, another question. How did you handle the gush of blood from temples? Did you re-inject or will you skip the injection for the time?
Talking about this photo, actually, this happened while I'm initially starting. I didn't start injecting, even if you notice, the syringe was still full, okay? Was full of the product. So when I'm manipulating the cannula into the temple, and I didn't start yet my injection, and even without initiating any aspiration, I found a gush of blood coming to my syringe. So simply, I stopped everything, went out very politely, okay, and aborted the treatment, the injection. But I discarded the syringe and used the rest of the product.
Okay, the final question. Can you tell us about the fact that according to the injection technique, that the Sculptra can make your face full or thin?
Again and again, so the question?
Again. Can you tell us about the fact that according to the injection technique, that the Sculptra can make your face full or thin?
So I always like to go for a reference, okay? According to one of the most famous trainers, international trainers of Galderma, specifically Sculptra, Dr. Avelar, I think from Brazil. He has both like different techniques of injecting Sculptra, and according to the technique and the place of injection or the injected area, you can control whether you are positioning this treatment for lifting and treating sagginess or for volumization. So for example, if you inject it for the submalar area, and you injected a good amount in this area, so you may need, so you may lead to some volume, or you may create some volume. But if you are injecting it more laterally at the temple area and the very auricular area, and fanning and spreading the product in a wider area, so it favors lifting and treating saggy face.
Thank you so much, Dr. Maher. It was a really great session. Thank you for answering all the questions.
Thank you. Thank you so much.
Thank you so much.
Goodbye. Goodbye.
Thank you. Okay, and now we're going to have a very short break. And during this break, we'll be streaming 2 videos. Make sure to watch them really clearly. The first video will be about full face masterclass. It's one of our highly selling course, which covers the advanced injection techniques for the filler, botox, threads, and exosomes. And also we'll be streaming a video about regenerative aesthetic injectables masterclass. It's a course that we in our American Association, we offer it for the doctors who are really ready to know more about the science and the application of biostimulator and skin boosters, and to have hands-on cases regarding the biostimulators. Okay, again, a reminder for all our attendees, you will find your certificate link already attached more than once in the chat box, and you will find the link for any doctor or any of our attendees who want to register with us in any of our upcoming course. Just fill the link and one of our team is going to contact you and give you all the details about our upcoming courses. And now we are pleased to welcome Dr. Maria from Ukraine. Dr. Maria is a licensed aesthetic injection and a specialist in pigmentation, melasma, post-acne scars, and anti-aging treatments. She is also an expert in MP gun techniques and educator and speaker at the MEDAM Medical Congress. She will be presenting her lecture titled Aesthetic Architect, Building the Face of 2030, with hybrid protocols. Hello, Dr. Maria.
Good evening, my beautiful people. How are you doing, guys? I hope everyone doing very well. And let me introduce myself from the beginning. As you heard, my name is Maria. I'm starting practicing since 2006. And I graduate as a bachelor degree, my first degree, and my second degree I get in 2020 from England. Being working in UAE since 2014. And unfortunately, tonight I have a little bit small issue that happened with my presentation. So I will go with what pictures I have to share with you my before and after pictures and to share some techniques that I'm using for my patient. So in UAE, we have many patients, especially I'm working in the Elysee Hospital. We have different type of patient. We have a surgical, we have injectables patient, and we have also patient, they don't want to do surgery, they don't want to have a filler and Botox, but they are still in the needs for a facial lifting, tightening, or regeneration process. So I would like to share with you my screen and I will show you a few pictures and then we go ahead. Let me see how I can do it. All right. Okay. Okay. 1 minute, please. Sorry.
Take your time, no worries.
Share. Share screen. Yeah. Okay. My screen is sharing. I don't know. All right.
Yeah, now it's shared.
Shared, yeah. All right. Okay, so we go for the photos. Sorry for a little bit mess. So let's start from one of the patients who were in Ozempic. The patient lost around 20 kg of weight. It was extreme weight loss when we can see very clearly that the patient lost a lot of volume, natural volume, and the skin started to be sucked. The patient doesn't want to do any surgery to tighten and to lift in the skin. As well, the patient doesn't want to have any filler to help her to elevate or any other type of boosters. So she is my regular patient for a long time and she came back to me and we start with her a combined protocol. One of the treatment that we done with her is a neuromuscular stimulation to enhance and to activate the muscles lifting. We're working with the full muscles. And then we done a collagen stimulator with a microRNA. It's a new technology that we are having in the moment, based from Turkey. It's a plant-based treatment. And this is the result that we see after 3 sessions. And here we can see in the video the way how the muscles are contracting. The depth of the contraction is really deep, so it's not like only vibration that can give you a slight relaxation. It's a full depth of the muscles contraction. We can see beautifully masseter being contracted, frontalis, platysma as well, nasolabial fold with the zygomaticus orbicularis oris, orbicularis oculis are involved as well. It's indirect muscles contraction. So what we are having, unless that it's muscles contraction. So while our muscles are contracting, we are having a lymphatic drainage. When the lymphatic drainage is draining all the liquids, waste material, as well, it's bring the nutrient and oxygenate the skin. So when we have all this, we are prepared actually the skin to receive the nutrients and get the best result. So with the hair protocol, we use the microRNA, call it H, and this is the result that we reach with hair. We can feel the firmness on the skin as well. We can even see the nasolabial fold, jawline defined. It's tightened, it's lifted, it's firmer, it's healthy looking skin. It's a natural look. Most of my patients, whenever I have them, they always ask me, Maria, like, I come to you because I wanted to have a natural look. So if we see the picture from before, and then we can see the video that we have after, we can really see a beautiful firmness, tightness, and lifting effect without overdone. And this is what the patient come and ask. Second case that I would love to share, the patient, she done a facelift surgery 5 years back. Unfortunately, the patient doesn't follow any kind of instruction. And I believe it was only the plastic surgeon, I don't know, maybe they agree in this way, but it wasn't a deep plane facelift. So what the patient have just cutting the skin and tighten the patient left with a scar over the sides. Unfortunately, I cannot show you full picture as a patient cover, but she allowed me to use her pictures for social media to be presented. As well, the patient done RF microneedling. It was quite aggressive. That left patient with a post-inflammatory hyperpigmentation. As well, we can see clearly the pattern of the RF microneedling. I believe the doctor was too aggressive or the patient doesn't follow home care instruction, because both cases, any energy-based devices, whenever we are doing, we need to really educate our patient how to take care post-home care. The education, I believe, is a key. The maximum informing our patient, it's the lead to better success for us and for the patients. And this is the result that we got with this patient. We have a 6 session of Wonder Face as well. It's a muscle stimulation that we can see elevation of her face. Plus, we done 3 session of Dream Scheme. Dream Scheme, it's my signature protocol. It's actually combination between salamandine, exosome, peptide, hyaluronic acid, of course, we need to for better hydration, as well antioxidant groups such as niacinamide, glutathione, vitamin C, and tranexamic acid. Now, at the moment, this patient is on remission. We let her a little bit rest, and she's supposed to come back after a couple months. And this is what we reach with this patient. All right, I think I will go back to the screen, and if somebody wanted to speak more about, where is my Zoom? Here. And if somebody wants to ask me more about particular pictures, I will be more than happy to give some details.
Thank you, Dr. Maria. Any questions? Okay, we can wait just for 1 minute.
Yeah, sure.
Any question? Please write it in the chat box. Okay, we have a question. What's the protocol?
So what is the protocol? For these two particular cases, I'm really apologizing for my presentation as I lost my presentation, so I just with my picture. So in this two particular presentation, patient protocol was a wonder phase. Wonder phase, it's a neuromuscular stimulation, plus it is radio frequency. So it's the device giving you a deep contraction. You can choose the program, whatever the patient is in need. For example, for this particular patient, we use a lift program. Lift program give us a deeper and a longer contraction with a 3 second of the break. So it's a 10 second of the muscles contraction and 3 second of the rest of the muscles. And then we done combination with microRNA. MicroRNA, it's a biostimulator with its kind of activation. It's a CO in our skin that give as signals to the skin to produce the collagen and elastin in the skin to help for firmness and tightness. So this is for both patient, and the second patient, the lady in hijab, she was having as well the dream skin that was combined with the microneedling technique to help her restore her skin health as she was done some other treatment.
Okay, perfect. Another question. Someone is asking, could you please repeat the combination therapy?
Yes, so it's a wonder phase, and for first patient, it's a microRNA.
Okay, another question. Have you done any biostimulators along with wonder phase?
Yes, of course, we done. We have different type of combination. We have many doctors as well that we like to combine. For example, even with oh my God, I forget the name of this one. Sorry, get my bad.
It's okay, take your time. It's okay. Maybe if you remembered later on, you can maybe link it in the chat.
Yeah, sure.
Okay, another question. Please, can you tell us some about the use of tranexamic acid for melasma?
Yeah, tranexamic acid is actually very nice for the melasma, but I am not only using tranexamic acid. I believe it's not enough. In combination with tranexamic acid, it's very nice actually, especially if you combine with the salmon and DNA or exosome combination with tranexamic acid, it will be very nice combo. This is what I'm doing. I'm not using like one ingredient particularly. I like to use combination because for melasma particularly, it's not only about to remove the pigmentation, it's about how to remove the pigmentation. And of course, the key of successful removal of pigmentation is to make your skin barrier as strong as possible, as well to restore the microbiome of your skin. Once your microbiome is restored and your skin barrier really strong, you are not only able to remove the pigmentation, but as well prevent the pigmentation. Treating pigmentation, it's not something simple or easy. It's really always when I have a patient, I like to explain a lot how the protocol going to go, how many sessions we need, and how many months, even a year sometime. Depends on the type of pigmentation, what the patient have. Is it melasma? Is it post-inflammatory hyperpigmentation? Is it a sunburn? Or it's a hormonal pigmentation. It depends on the type of the pigmentation. The protocol are actually very, very individual.
Okay, thank you. Another question. Can we mix exosomes and tranexamic acid while microneedling?
Yes, I do such a protocols, even though I do different type of combination with micro peeling, like a messenger peel, especially I like a lot to have a messenger peel. Messenger peel, it's a repairing type of acid. It's actually very healthy that help us to, let's say, a healthy exfoliation. It's not aggressive peeling. It's a healthy exfoliant. And we're applying literally like for 5 minutes and then easily wash it out with the water. And when we apply the microneedling directly after the messenger peel, we can really reach a deeper layers of pigmentation to be removed. In the same time, it's a restore as well. It's help the skin gently exfoliate without harmful peeling off. So the patient are feeling comfortable. The exfoliation is actually very gentle for a couple of days that doesn't leave the patient with excessive redness. As well, when I treat the pigmentation, I always taking care to not cause any type of inflammation, because inflammation is a trigger for a pigment to be spread, and we don't want that.
Okay, perfect. Another question, what to do if a patient do not having any melasma before, but after doing meso and PRP hair, melasma checks come? What treatment should we do next?
Meso and PRP hair?
Yeah, hair melasma checks come.
Okay, so I believe it's post-inflammatory hyperpigmentation, what is happening. Energy-based devices like RF microneedling or aggressive peeling, any aggressive treatment can cause post-inflammatory hyperpigmentation, which later on is really very hard to treat. First of all, we need to work on healing process here. We don't think in the moment when it's happened about another treatment or more aggressive treatment. What we think, what I'm thinking, and what I'm doing actually, and I have many cases that the patient is go somewhere and they have aggressive treatment, or the patient doesn't follow and reach to the very deep post-inflammatory hyperpigmentation. So in these cases, always I start with a gentle treatment to repair the barrier, to make the skin strong as possible. And only after that, I will take care of the pigmentation.
Okay, for the next question, can we do RF microneedling in melasma patients?
Me personally, I wouldn't recommend, as RF microneedling can spread pigmentation more, as it's a heat-based device, and any type of energy heat-based device for melasma can trigger and can really easily lead to post-inflammatory hyperpigmentation.
Okay, and for the next question, can you approach a case of post-acne scars?
I do have post-acne scars. Actually, I cannot show you now picture because I need to go through all my phone, and it's something private, let's say like this. But yeah, RF microneedling could be good for acne scars, as well as a microneedling as well, with exosome, with the peptides, something more regenerative. Salmon DNA in combination is make very good. Recently, I try as well a patient who come for the skin tightening, and I done with her microRNA. It's a collagen stimulator, and she have an acne scars, but her concern at that time was a lifting effect. So after a month, after post-treatment, she come back and she told me like, Maria, you know, I'm noticing my scars, they get reduction. Any microneedling, any collagen stimulators as well, it depends on the type of scars, can really support a lot to the patient's healing. But again, it depends how long the scars, if the pigmentation is present in the scars, if there's an inflammation in the scars. So for example, if the patient is having, let's say, old scars, the inflammation could be still there. But for me personally, I would start with inflammation to reduce the post-inflammation. And after that, only I will treat the scars.
Okay, another question. How to manage acne in 15-year-old boy? Should we go for peeling?
Well, it's a teenager. First of all, I would really recommend you to visit a doctor dermatologist. Let's do the blood test. But anyways, for sure, it's a teenagers. They are all growing. We are grow up with that. So I always suggest something very gentle for them. These teenagers, nothing aggressive. Sometimes if you change and if you put teenagers on the proper home care, let's say a good cleanser with some salicylic acid, something antibacterial, anti-inflammatory, and like anti-inflammatory creams and a good sunscreen to not cause, of course, it can help, but some cases the inflammation and the acne are really too aggressive that really require a doctor of dermatology and prescription of some maybe medication, even though I've we don't want this acne to become cystic, because cystic acne going to lead to really deep scars, and we don't want it to play with these pimples, because of course it's going to lead to another scarring. So always better to take care, a good home care, a good doctor dermatologist that gonna support a lot. And as soon as you go, better it will be, because you're going to help your child to grow up beautiful or handsome and healthy. You know, it's our kids in the end. So yeah, I would give the best suggestion like this.
Okay, we have more than another question. So every time I'm going to put this will be the last one. People still are asking.
Yeah,
Okay.
sure.
Have you done filler with Wonder Face?
So for example, if the patient done already filler, the patient still can do the Wonder Face. And by the way, it's so good for patients who have a filler to do the Wonder Face. Why it's so good? So for example, from the time the filler was placed, we need to wait 1 month for the filler to settle properly. And after that, we can do the Wonder Face. But what is the biggest benefits about the patient who already have a filler, how the Wonder Face can really support this type of patients? So for example, if the patient have a water retention, like for example, like me, I'm deformative type of aging, and I always have a water retention on my face. Some patient, when they done the filler, the water retention are really present, and it's helped to drain the water. So the patient looks slimmer, the patient look tighter without over puffiness. And this is one of the side effects of the filler, because the filler drawn the water. So yeah, it's highly recommended. And even though depends how long the patient was use filler, some patient using for many years, the gravity still do the job that we don't like it. It's get a little bit looser and get always more down and down. And this is when the Wonder Face will help to lift all of that together. And very nice effect. I have many patients. Actually, each second of my patient, they have filler done, they have Botox done. By the way, regarding the Botox, I have a patient who was coming to me and he say, Maria, like, I don't know, the Botox are going every 2 months, 3 months. I need to do the Botox. How can I help? I cannot do always. So we done for him a Wonder Face protocol and some collagen stimulator. And then he done the Botox, and the Botox was miraculously staying very nice. It's long lasting because we all knows that when the patient have a Botox, it's the elasticity and the movement of the muscles are really down and reduced. We need to restore all this function of the muscles. So Wonder Face are able to restore. It's more like physiotherapeutical when the muscles have a trauma, and then we are restoring the function of the muscles. So we have a proper muscles lifting, let's say, especially on the face. As we know, where there is a muscles call it elevator, there is muscles who call it depressors, but they need to be properly managed, and the time it's help, nothing, sorry. Yeah.
Okay, another question. Can we inject biostimulators on scalp for hair regrowth?
For the hair regrowth?
Yeah. Like if a male or female has a pattern baldness in younger females, especially.
Well, I have many patients. The most youngest patient that I ever had for hair loss, it's a boy. He have 16 years old, and I can say he have 50% of the baldness already. It's something genetically inherited from the parents, and we start with him protocols, and because there was no help, and his mom doesn't want to put him on the minoxidil, and because he went to the doctor and the doctor recommended for him minoxidil. Well, I don't like to recommend minoxidil for my patient. I prefer, and I see much more effect from the let's say exosome, for example. Exosome is very good, especially the third generation of, again, the microRNA for the hair growth. It's a beautiful protocol. I don't know if you're following me on Instagram, but you can see a beautiful regrowth, and I need only 4 sessions. The patient doesn't matter, is it alopecia or it's post-cancer patient who have chemotherapy, let's say, or just the hormonal disbalance for the patient, especially the female, post-pregnancy, perimenopause, menopause, we all have a lot of hair loss during this time. So it's required actually a proper protocol. But yeah, in my protocols, we are having a 4 session and the patient being following for another protocol, like long, which is every 2-3 months we are doing 1 session. It's mean like almost every hair growth cycle we are giving a 1 dose.
Okay, perfect. For the next question, is there any role of isotetraneone in improving the acne scars?
I don't know what to answer for this question, to be honest.
Do you want to skip it?
Can I skip it? Because I don't want to say anything bad, you know.
Okay, for the next question, what do you recommend for acne marks treatment?
Acne marks treatment, exosome. Exosome, it's one of the best combination, but again, what type of acne marks? It's also making sense. Some acne marks has still, as I speak before, inflammation. So then before you start with acne scars, let's say, you need to start with the inflammation if there is still present inflammation. If there is with the pigmentation, so of course I prefer to combine the protocol for scars and something for pigmentation that we have treating properly together. But I never work aggressive on any scars or any pigmentation.
Okay, maybe this will be the last question. How to reduce periorbital puffiness?
Okay, periorbital puffiness, it's actually a very common condition that we are having here. It's very important for the lymphatic drainage. Water retention sometimes can give us really a lot in the periorbital area, and the Wonderfay is working miraculously. Like even if you do, for example, a manual massage will really lead you to very small improvement. Or for example, some bloggers and all this recommending the Huasha technique. It's very good for the lifting and lymphatic drainage. From my experience, I would never recommend for patient to use any Huasha, especially as the Huasha is only stretch the skin, especially if the patient have no knowledge where is your lymph nodes going in which direction to drain. It's very bad. But for professional use, Wonderfay is number 1. As it's really when the muscles are contracting, you are drain all your lymph nodes, not only on the periorbital area, but in all face. And the neck that literally will lead and drain all to the axillary lymph nodes, where is all supposed to be circulated.
Okay, thank you so much. Thank you. It was a really great session. Thank you for answering all these questions and giving us from your techniques and all of this stuff. Thank you. It was a really great.
My pleasure.
Thank you so much. Thank you, Dr. Maria.
Thank you so much.
Okay, and now we are waiting for Prof. Dr. Mustafa to join, and this will be our last session, and we will be waiting. Dr. Mustafa already joined. So please let me welcome Prof. Dr. Mustafa Isa from Algeria, one of the leading figures in the field of plastic and aesthetic surgery. Prof. Dr. Mustafa is a consultant plastic and aesthetic surgeon and the president of the Algerian College of Plastic and Aesthetic Surgery. He is also an active member of both ISPS and ASAPS, reflecting his distinguished international standing and long-standing contribution to the specialty. And now he will be presenting his title as Biostimulators and Collagen Stimulators in 2026, Global Market Evolution and Innovation, Ethics and Regulatory Challenges. Welcome, Prof. Dr. Mustafa, can you hear me? Dr. Mustafa, could you hear me? Dr. Mustafa.
Yep.
Hello. Could you hear me?
عم يعيطوا لي؟ ماشي يخرج لي الصون. راك تسمعني؟
Yeah, we can hear you. Could you hear me well?
ميرد.
Okay, if you are ready to start, we
عايش نخرج.
are ready to hear from you.
ميرد.
Okay, just 1 minute and Dr. Mustafa is going to join again. Dr. Mustafa.
دعني؟
Hello, doctor. Could you hear me?
دعني؟
Dr. Mustafa, we already we can see the screen, but could you hear me? Dr. Mustafa, your mic is already muted. Could you please unmute?
Hello, everyone. Good evening, and for someone, and good afternoon, good morning for there in the Pacific time zone. Welcome to this webinar organized by the American Association for Continuous Education, one of the leading global institutions in continuing medical education, with a strong presence across the MENA, which is the Middle East and North Africa. My name is Mustafa. I am physician executive with over 30 years international clinical experience and spanning plastic, reconstructive surgery, wound care, academic leadership, and healthcare strategy. Today, I'm mainly focused on translating clinical excellence into medical affairs, clinical development, and biotechnology leadership. Over the next 30 minutes, we will explore one of the most dynamic and rapidly evolving sectors in the aesthetic medicine, which is the biostimulators and collagen stimulators. We will cover the global market landscape and the major products categories, the clinical and innovation trends shaping the field, and critically, the ethical and regulatory challenges that industry must urgently address. Let's go for the overview. Next slide. Okay. Sorry. Let's go. Make it bigger. Okay. The agenda today will start with the global market size and growth figures because the context matters before we dive into the specific products. We will then walk through the main biostimulators categories, which is the PLLA, the CHA, PCL, and PPMA, which each its own mechanism, market positioning, and key products. Next, we will look at the emerging regenerative injectables, which is the polynucleotides, exosomes, hybrid products, which are reshaping the innovation landscape. We will then analyze regional difference between this market, which is not uniform globally. North America, Europe, Asia, Latin America, and the Middle East each tell a different story. After that, we will review the competitive landscape, the key companies, and products diving into space. We will discuss the major clinical trends fueling demands, including the GLP-1 effect, the body biostimulation, and the combination of protocols. Then we will dedicate an important time to ethics and regulatory challenges, because rapid commercialization without adequate oversight is a serious risk. And finally, we will look ahead to 2030 and beyond, which is tomorrow. Let's see the global market. The global regenerative injectables market is currently estimated at $2.1 billion in 2026, with a projection reaching over $5 billion by 2033. That represents a compound annual growth rate of 10 to 12% annually, making this one of the fastest growing sector in aesthetic medicine today. Look at the chart. On the left, you have the trajectory. The trajectory is steep and consistent from 1.1 billion in 2022, going to on the clear path to doubling and then nearly tripling market size within a decade. The pie chart on the right shows how the market is divided by category. Calcium hydroxylapatite, CHA, currently leads with approximately 32% of the market, followed by polylactic acid, PLLA, at 28, polycaprolactone, PCL holds 18%. And the polynucleotides and PDRN represent a rapid growing of 12%. What is driving its growth? Several converging forces: the global shift regenerative medicine, the Ozempic effect for the GLP-1 weight loss drug, rising demand for preventive aging treatment, and the explosion of body biostimulation procedure. This is not a niche market anymore. This is a mainstream of aesthetic medicine. Now, let's just walk through the 4 established biostimulators categories. The first one, which is the PLLA, this remains the global dominant collagen stimulator. Sculptra by Galderma leads toward, globally, it's on the leader, with Lanluma strong in Europe and Latin America. Istefil growth fast in Asia. The PLLA market alone is estimated at $223 million in 26, projected to exceed 400 million by 2023. The mechanism is progressive collagen induction. Results will gradually over weeks to months, making the ideal for volumetric restoration and preventive aging. The second, which is the calcium hydroxylapatite, the lead by Radies, which is Maher's aesthetic in the flagship product there. CAHA acts as both immediate volumizer and the long-term collagen stimulator. The fastest growing application is hyperdilute, dilute 1 by 1 or 1 by 4, used for skin tightening on the neck, arms, décolletage, and cellulite treatment. This has transformed the CAHA from a classic filler into a powerful regenerator tool. The third family, which is the PSL, this is the fastest growing advanced category. Elance offers long duration collagen stimulation, while Guri and Lenisma from Dexlevo represent the cutting edge concept of injectables PCL. South Korea is driving most of the innovation here, with the hybrid PCL and combination leading the way. The last and not the least, which is the PMMA, polymethyl ethyl, which is led by Belafil, remain the primary product. Is a permanent biostimulator, which gives it both advantages and limitation. It maintains a loyal but relatively small physician base, used primarily for acne scarring, long-term correction, HIV-related lipoatrophy, concern around permanence and granuloma risk, limits its broader expansion. Each category has its distinct mechanism, duration, patient profile, which is why informed product selection is critical. Now let's see what's the emerging regeneration injectable. Beyond the established categories, we are witnessing an exciting wave of next generation injectables. Polynucleotides and PDRN are among the most rapidly expanding categories, particularly in South Korea, Italy, the United Arab Emirates, and across Europe. Products like Regeneron, Plinest, Nucleophil worked by stimulating fibroblast activity, improving skin hydration, promoting tissue repair at the cellular level. They address skin quality rather than just volume, which during the communication of Danny, he emphasized on this aspect. Exosome-based injectable, which is the second family, represent the most cutting-edge frontier, derived from mesenchymal stem cells or other cellular sources. Exosomes carry growth factors and signaling molecules that can modulate tissue repair and regeneration. Commercial interest is high, especially in Asia and the Gulf region. However, I want to be direct with you. Formal regulatory approval for aesthetic indication is still very limited. Take this note, very important. I repeat, the products are being widely marketed, but the approval for aesthetic indication is still limited. Means this is a concern. We will return on it in our ethics slides. The last one, which is the hybrid injectables. It is the fastest growing segment, combining HA with PLLA, HA with PCL, polynucleotide with plus HA, and even exosome hybrids. They are perhaps the fastest innovation segment, driven primarily by South Korean companies. The concept is powerful. Immediate aesthetic result combined with long-term biological regeneration in a single injection. The warning, I insist, the warning at the bottom of this slide is important. As physicians and healthcare professionals, we have a responsibility to understand what is approved, what is experimental, and what are injecting in our patients. Every patient, consider your patient as your beloved family, your wife, your sister, your friend, your best friend, before injecting to any substance for these people. Now let's see the regional market. All of us, we are talking about the global market, but it is completely different stories. Let's see, for example, it is really highly regional, and understanding where the growth is happening and why it is essential for anyone operating in this space. It depends for the attendance. Where are they? Are they in the Middle East, Latin America, Asia, Europe, North America? We know that this talk is organized worldwide. North America remains the global revenue leader, accounting approximately 40% of the total market. The United States is dominated by Sculptra, Radiesse, and the most important emerging trend there is the GLP-1 effect. Patients on Ozempic and similar weight loss drugs are experiencing rapid facial volume, which as a surgeon and plastic surgeon, we dealt with this issue a couple years before when the bariatric surgery arrived in the market. Now we are creating an entirely new patient population, seeking biostimulators treatment, preventive aesthetic and male aesthetic medicine. Don't forget, the male aesthetic medicine are also growing significantly. Europe holds around 25% of the market. The aesthetic culture where favors natural physician-led outcome, like France, Italy, Spain, UK are the leading market. Lalluma and LNC, both by Sinclair Pharma products, perform strongly, and polynucleotide has a very engaged physician base in Italy. Asia Pacific, approximately 22, is the most important region to watch from an innovation standpoint. South Korea is truly the global laboratory for aesthetic innovation. Liquid PCL, hybrid biostimulators, skin booster, exosome combination are all being pioneered there. Medical tourism in Thailand and growing domestic demand in China and Japan are additional driver. Latin America, led by Brazil, is the world capital of body biostimulation. Brazilian physicians have developed and popularized protocol for buttock enhancement, cellulite treatment, full body contouring with biostimulators that are now being adopted globally. The Middle East, while smaller, approximately 4%, is the fastest growing luxury aesthetic market. Saudi Arabia, Qatar are investing heavily on preventive and combination regenerative protocol. Every region presents unique opportunities and also unique regulatory and cultural considerations. Where are we in the North Africa and Africa? It doesn't show in our graph. Why? Because our market is still emerging. We are still looking for means. In this market, we have to take in consideration the experience of all these regions and to adopt a real strategy for the future. Look at the competitive landscape. Look who is competing. Now, we have, for example, Galderma. Galderma is the undisputed global leader in PLLA with Sculptra, a product with decades of clinical evidence, broad regulatory approval, and strong physician loyalty across all major markets. Maher's aesthetic leads with CAHA with Radiesse. The investment is in hyperdilute protocol and body application has successfully repositioned Radiesse beyond its origin and facial filler. Sinclair Pharma occupy a unique dual position. They offer both LNC and PCL and Löntlua in PLLA, giving them broad regenerative portfolio coverage in Europe and Latin America. Dexlevo from South Korea is perhaps, for me, the most disruptive newcomer in the space. Guri, their injectable liquid PCL, is technically innovative and challenges the traditional injectable format. Lenisma extends with a PCL-HA hybrid concept. VIM Global Juvlook, a hybrid PDLLA product represent a growing category of combination collagen stimulator with immediate and delayed dual action and mechanism. And pharma research products with Regeneron. Regeneron has built the gold standard of polynucleotide therapeutics with a strong evidence base, particularly in Korea, Japan, and now expanding into Europe and Middle East. What we see there, that the market well established globally, leader in the foundation categories, and a wave of specialized Asian innovators disrupting with the next generation regenerative technology. The competitive intensity is increasing and consolidation through partnership, licensing, and acquisition is expected to accelerate through 2026 to 2023. The clinical trend driving the market. 4 major clinical trends are reshaping the biostimulator market. 1, the regenerative aesthetic shift. This is a fundamental paradigm change. The entire industry is moving away from the traditional model of filling simply, replacing volume, toward a biological approach that focuses on tissue restoration, collagen induction, long-term rejuvenation. Patient and physician alike are increasingly asking not just how I can look better today, but how I can improve my skin biology for the long term. Biostimulators are the center of this answer. The second trend, the GLP-1 and the Ozempic face effect. This is perhaps the most discussed phenomenon in aesthetic medicine right now. Semaglutide and similar GLP-1 receptors agonists are incredibly affect the weight loss, but they cause rapid and sometimes dramatic and fatal loss, body deflation. The patient lose volume, experience acceleration of skin laxity, and show early sign of collagen depletion. Biostimulators, particularly PLLA, CAHA, are now routinely used to address these changes. This is not a temporary trend. It is a growing patient population that will drive biostimulators demand for years to come. The third trend, fully body stimulation. Okay, historically, biostimulators were used primarily for the face. Today, the neck, arm, buttocks, abdomen, thighs, and décolletage are well-established treatment area. Body biostimulation, particularly hyperdilute CAHA for skin tightening, PLLA for volumetric body rejuvenation, is one of the fastest growing procedural categories globally. The fourth trend, combination therapies as the new standard of care. The modern approach combines biostimulators with radiofrequency microneedling, PRP, polynucleotides, energy devices, and exosomes. These multimodal protocols produce synergistic results that not a single modality can achieve alone. This is where the field is clearly heading. Now, this is for me today, after we have heard different experts talking, and I am in the last one, I want to emphasize and talk with this for me the major slide that I want to explain, which is the ethics and regulatory challenges. This is perhaps the most important slide in the presentation, and I want to speak frankly with you. The biostimulator and regenerative aesthetic market is growing faster than the regulatory and ethical framework governing it. Means money is going faster than science. These create real risk for patients, for physicians, and for the long-term credibility in our field. We are losing on daily basis the credibility of being the physician. In Arabic, al-Hakim, not anymore. Now, on the left, you see the key concern, gray market distribution. Kaaba means that the products are being sold and used in many countries without proper authorization. Counterfeit or poorly characterized biologic material, and including exosome and stem cells derivative, are entering the market with no guaranteed safety profile. Misleading marketing is targeting vulnerable patients, with exaggerated claims about stem cell regeneration or instant regeneration that are not supported by the clinical evidence. And consistent physician training means that highly complex biologics are being administered by practitioners without the necessary skills, knowledge, and post-market surveillance. Is fragmented and non-existent immunity. There is many regions, they are doing things in a chaotic manner that sometimes it will make the utilization of those technologies really doubtful. On the right, okay, we are talking about the problem, which is the key regulatory concern. Now let's see what's the solution. We are always talking about the problems, that never mind, we have to go for what is the solution. Means we have to do urgently international regulation harmonization. Do you know that even in Europe, like for example, France, for example, just 2 days ago, there was a huge investigations done about the regulation. The regulations are not enough standardized, they are not enough evidence-based medical field. We need GMP standardized manufacturing so that every vial of injectable biologic meets the same quality standards regardless of where it is produced. We need global adverse event registries so that safety signals can be detected early. We need AI-assisted post-market surveillance and cross-border traceability. Physician ethics are equally critical. Every practitioner using these products has a responsibility to provide honest, informed consent about what is approved and what is experimental. Avoid exaggerated marketing language and follow evidence-based protocol. You can't imagine, as a peer reviewer and editorial board of the leading journal of plastic surgery in the world, which is the PLLA, I am reviewing on a daily basis articles complaining about issues, risk, complications, major issues. The European Union regulation, FDA quality system reform, and emerging Asian framework are already tightening oversight. And this is a good thing. The long-term success of regenerating aesthetic depends on not just on innovation, but also on integrity. As the quote at the bottom state, the future credibility of this market depends on scientific integrity and ethical transparency and patient-centered safety standards. What's the future outlook 26, 23, 30? The trajectory for this market is clear and exciting. The line chart shows projected growth for these three fastest growing categories. PLLA continue its steady climb toward $400 million. PCL is on the course of surpassing PLLA in growth by approximately 228, driven by liquid PCL, innovation and hybrid formulation and polynucleotides and PDRN. Show steepest growth curve, all the three reflecting enormous unmet demand for skin quality treatment. On the right, you can see the trends which would define the industry. Hybrid injectable will undergo rapid expansion. The market is clearly moving toward dual action. Exosome integration will grow significantly, through it will also face increasingly regulatory scrutiny. AI-guided treatment planning is emerging. Algorithms are being developed to help physicians customize biostimulated protocols based on patient imaging, skin analysis, data, and history. Now, the male regenerative aesthetic represents one of the strongest growth segments. The stigma around aesthetic procedure for men continue to decline globally. Body biostimulation will see explosive growth driven by GLP-1 patient, body contouring, and personalized treatment protocol tailored to each patient genetics, skin biology, lifestyle present the future of standard care. In summary, we are at the inflection point. The next 5 years will determine which companies which technologies and which clinical approaches define the future of regenerative aesthetics. What we have to take home today, after a couple of hours discussion, listening to different experts, and thanks God we have this association that give us the opportunity to talk with a great honor. Let's see, before we open the questions, let me leave you with 7 key take-home messages. 1, PLLA remain the dominant collagen stimulator globally with the broadest regulatory approval, the most robust clinical evidence, and the largest installed physician base. If you practice aesthetic medicine, polyallyl acid should be part of your toolkit. Now, calcium hydroxylapatite leads as the top hybrid filler for tightening and lifting. The evolution to hyperdilute protocol has dramatically expanded its clinical application far beyond classic volumization. 3, PCL is the fastest growing advanced regenerative category driven by South Korean innovation in liquid and hybrid formulation. This is a space to watch closely. 4, South Korea and Asia are the engine of global innovation in this field. If you want to understand where biostimulators are going, look east. No, I'm not saying that don't look west, but looking east gives you a large overview what's happening outside. How about 5? Regenerative aesthetic is fundamental, reshaping the injectable industry. The old model to feel and go is being replaced by biological, intelligent, long-term rejuvenation strategy. 6, body biostimulation is no longer a niche. It is one of the fastest growing aesthetic sector worldwide. The era of treating only the face is over. 7, GLP-1 weight loss medication are creating new patient population with specific biostimulator needs. And this trend will only intensify as these drugs become more widely prescribed globally. These 7 messages summarize where we are going and what we as clinician and industry professional needs to prepare for. In the end, I want to thank you very much for your attention and your time today. We have covered a great deal of ground in 30 minutes, from the global market size and the main biostimulator categories through the emerging regenerative technologies, the regional dynamic technology, the competitive landscape, the clinical trend, and the clinical, ethical, and regulatory challenges that will define the future of this field. I hope this session has given you both a strong strategic overview and a practical clinical insight that you can apply in your practice or your work. I am grateful to the American Association of Continuous Education for the privilege of presenting for this distinguished audience. ACA's commitment to empowering healthcare professionals through international accredited CME program is exactly the kind of initiative that elevates the standards of care and knowledge across our profession, particularly in the MENA region and globally. I am now happy to open the floor for questions and discussion.
Thank you so much, Dr. Mustafa. It's our honor to have you. And on behalf of the American Association, I would really like to thank you so much. And it's our honor to always have you with us. And for now, we are going to receive the questions. So please, if anyone has any question for Dr. Mustafa, could you please put it in the chat box?
Can I make a comment? Just concerning the medical education. As I am a member of the American Society of Plastic Surgeons, I'm involved in the Continuing Medical Education Committee and Regulatory Affairs. We are trying to find the niche, how to globalize the regulation. Plastic surgery, aesthetic surgery are nowadays not a new trend. We are facing new challenges with medialization, with internet, with AI, and people are aware. Every single villages in Africa, in Asia, people knows what's happening. The problem is those people having gathering many information through internet, through TikTok, through Zoom or anything else, we has to be guided by the physician. As we have to give the most important time for the patient to listen and to explain on a routine basis what we are doing for them. We are not dealing with an urgent matter. We are not dealing with disease. We are dealing with enhancement, rejuvenation, giving a touch for those patients. Means the use of these products, they are not safe without evidence-based medicine. Those products for sure are on the market. You have to trust on your physician. You have to have the maximum of education and the maximum of information. Without the patient, which is the center of our focus, without the importance of the patient, we can't make the medicine growing safely in the future. The ideal timeline using biostimulators should be started during or after. Good question. Definitely. I was working in one of the leading centers dealing with weight loss in Algeria, North Africa, in the University Hospital Oran. They were the leading in the almost 20 years ago, starting the bariatric surgery. We tried to work as a team. It was a team where there is the plastic surgeon, there was the endocrinologist, the psychiatrist, there was the general surgeon, even all these people working together to give the best indication for those. Means going for weight loss. We tried initially before the patient goes for the surgery, he started to get information. But what will happen? Means we have a kind of techniques how to make patient losing weight progressively, how to entertain the skin. We talked about biostimulators. How about hydrating? How about drinking much water? How to get having a good diet? Yes. Now, using biostimulator can be now shift. It's a for sure. Actually, they are using it after the weight loss, but we can in the future starting doing and using biostimulators before, during, and after the protocol.
Thank you so much, Dr. Mustafa. And we have a question. What's the ideal timeline for using biostimulators?
I said now we have, we knows very much what happened after waiting. Now we can start it before, during, and after.
Again, thank you so much, Dr. Mustafa. We are really honored to have you today. Thank you so much for your time and thank you so much for your effort.
Thank you very much and have a great day. Have a great night for those in West and great day for those in the West. Thank you. Thank you very much.
Thank you. Thank you so much for all who wait for the ending of our webinar, and I hope that you had a really fruitful time with us. And again, on behalf of the American Association for Continuous Education, I would like to thank everyone who stayed and listened to our professors and our doctors, and especially very welcome for anyone who wants to join any of our upcoming courses. And at the end, again, I would like to thank all of our professors and doctors who made a great effort to make this webinar a very organized and very well established one. Again, on behalf of the American Association, thank you so much all, and have a great day.